Hello everyone. I guess I'm live, right? So for all those who are attending my session for the first time, I am Dr. Priyanka Sachdev here and I welcome you all for today's session. A very, very good evening to all of you. So today here I am to cover the entire general microbiology in one shot, right? In this session, in this 4-hour session, we will be covering entire general microbiology in just one shot. Am I live? Am I clearly visible, audible? Can you write down in the comment box, please? Can you see clearly? Okay. So, how many of you think that microbiology is a boring, monotonous, non-conceptual, volatile, or rectification sort of subject? Huh? You can write down without any hesitation in the comment box. Do you think like so? Is it? I guess many students think like this. Many students tell me that microbiology is a very non-conceptual and a very volatile subject. Is it? Do you also think like this? Yes? So just be with me for the next 4 hours. I will ask the same question at the end of the session and let me see if I can change your perception. Okay, so as now exams are on the corner and I got many requests from hundreds of students as both university exam as well as NEET PG is around the corner. I got many requests from many students that I must conduct a rapid revision of the entire microbiology, right? So I came up with my strategy. So here is my strategy. You can see it's FinalGear Microbiology. It's a 25-hour rapid revision crash course of the microbiology in which I will cover entire microbiology at 4x speed. Okay, it is just brushing up your concept at a super fast speed without skipping any concept, without skipping any topic. So I will cover the entire microbiology in 7 sessions. Okay, each session will be 4 hours long and all the sessions will be in the evening hours preferably because you can attend it live. All the recordings are also available, but I want you to attend it live so that it will be interactive and it will you can learn the entire microbiology on the spot with me only. Okay. And here is the detailed schedule of the course. You can see the FinalGear Microbiology. You can see the detailed schedule. The total 7 sessions with the corresponding topics are in front of you. The first 2 sessions today and tomorrow, okay, are on the YouTube. The remaining 5 sessions are on MedLive by Dr. Priyanka app. So today I will teach you general microbiology, complete general microbiology in one shot, and tomorrow I will teach you entire serious infections in one shot. I will teach you the corresponding syndromes, bacteria, virus, fungus as well as parasite in this system tomorrow. And after that, the remaining systems and immunology, you can see the corresponding schedule. Got it? Now, what are the special features of this course? This course is just 25 hours. It is super rapid. It is high yield. It is compact yet complete. Let me elaborate it. You may be thinking that I am going to skip many topics. I am going to take the topics superficially. No. It's not like that. It is compact, I agree, but it is yet complete. How I will make it possible, I will let you know this. Okay. And the most important thing, it is according to new CBME curriculum. I will not teach you organism wise. I'm not going to teach you bacteriology, virology, mycology, parasitology, the old way of teaching. No. I will teach you system wise according to the new CBME curriculum. I will teach you the entire microbiology in 8 systems. You can see the 8 systems over here, right? And I guarantee 100% strike rate in your university exam as well as NEET, PG, FMG, INICT, all the competitive exam from this crash course. Okay, now you may be thinking, ma'am, how it is possible? The entire microbiology in just 25 hours and you are saying that it's 100% strike rate? How it is possible? So let me reveal my secret magic or my secret weapon. The students who are already studied microbiology from me, they already know my unique way of teaching microbiology. I teach the entire bugs in microbiology in comparative tabulated form, and that's what I call the master chart. So let me introduce the master charts of the microbiology. Okay, what is this master chart? What do you mean by master chart? So in these master chart, I will take 150 organisms, including approx 60 bacteria, viruses, parasite, fungus. 150 organisms in comparatively. you can appreciate the comparative way under a fixed set of heading, under a fixed set. So retention is easy. You can see the all culture media in one column. You can see the lab diagnosis in one column. You can see the clinical features. You can see the drug of choice in one column. It's very easy to revise and retain the 150 organism in the form of these master chart. It's a calendar. It's not a book, but it's a replacement of the book. For book, you have to take the book and read the book for hours. Still, you don't remember it. How many pages your standard textbook of microbiology have? I think 800 or 1000. It is just 66 page. And that too calendar. It's a calendar format. Just hang it on your wall. Hang it on your wall and flip the pages. Daily flip the pages. You don't even realize when you will retain the entire microbiology, right? So this is how we are going to cover the entire microbiology with the help of color-coded systemic microbe with master charts. That is the magic, and it is possible. And I guarantee the 100% strike rate. Got it? Yes or no? So you can see the microbiology master chart, 150 bucks in just nearly 60 pages. You can see all bacteria, virus, parasite, fungus. I will not skip even a single bug. Even a minor bug I will cover in these 25 hours. Got it? And that is the best way to revise it. The master chart, my calendars. Okay, my secret magic of the entire microbiology. Okay, now before I start the session, there's an important announcement. You want these free? How many of you want these microbiology master chart for free? So we are conducting a quiz at the end of the session. Be with me for the next 4 hours. Okay. At the end of the session, we will conduct a quiz in which there are 10 questions, 10 simple questions that will be from this session only. The first 20 winners, the top 20 scorers of this quiz will get the master charts free. You can read the rules of the quiz. So just be with me for the next 4 hours and you will get this master charts free of cost. Okay. There is one more surprise waiting for you in the end. Okay, I will reveal it in the end. And one more thing before I start. Maybe as it is a rapid revision, I will not be able to pace up with the chat box. Maybe you are asking some query, but I am not able to attend that query, but I genuinely want to answer all your queries. So you can note down this number. Please drop your queries over here. Okay, whenever I will be free, I personally will solve your all the queries. Maybe during the session, I am not able to do so because it's a rapid revision and I have to cover a big portion in a small duration. Got it? But please note down this number and WhatsApp your query on this number, whatever related to this session on microbiology. Okay, now, are you ready with your workbook? We have already uploaded the workbook in the free demo session. The link is already there in the comment box, in the pinned comment in the comment box. You can see the workbook link there. I want all of you to download the workbook and take a printout. If you have not taken it today, it's okay. For tomorrow's session, you can be ready with the workbook. What is workbook? 60% content is already printed. 40% is blank. It is intentionally blank. Okay, and the spaces I have kept blank, they are intentional. I want you to write it during the session with me. That is the concept of the workbook. Notes of this session will be uploaded just after the session. You will get the notes also in that link. Okay, so let's start it with this introduction. How many of you are ready? Can we start? Give me a minute. Can we start the session? Yes, I think I must start. Just a second. Okay, so let's start it. Let's start the general microbiology, first session of final year microbiology, general microbiology. Okay, so in general microbiology, we are having 4 sections: general bacteriology, general virology, general parasitology, general mycology. Now you may be knowing 80% of it is general bacteria only. The remaining are minor, in which you have to just see the classification and little bit. But maximum portion, the biggest portion is general bacteriology. So we will start with general bacteriology, we will finish it, then we will move on general virology. If general parasitology, mycology I can cover today till 10 or 11, it's good. If I am not able to cover it today, I will upload the recording on the app. I guess I will be able to cover all 4. Okay, so let's start with the biggest portion, general bacteriology. Let's start it. Are you ready? Okay. So my first topic, most important topic, staining of bacteria. Let me ask you a question. Why it is necessary to stain a bacteria? Is it necessary to stain a bacteria? Wait. Understand my question first. This is my specimen. My specimen can be anything. It can be blood, it can be urine, it can be CSF, it can be feces, it can be anything. Suppose this is my specimen and I suspect it contains bacteria. Why not I take a drop on the slide? Okay, why not I make a smear, and why not I examine directly under microscope? Why not I do so? No, I can't examine it directly under the microscope. First, I have to stain it. First, I have to stain it. Then only I can examine under microscope. My question to you, why? Why it is necessary to stain? If you understand why, then you will be able to answer why staining is necessary. Do you know the answer? Yes, the correct answer, because the bacteria are transparent. How many of you know that bacteria are transparent? You know bacteria are transparent. I guess everyone knows slide is transparent. How many of you know bacteria is also transparent? Can you see a transparent object on a transparent background? Can human eyes see a transparent object on a transparent background? No. The answer is no. Human eye need contrast to see anything. Since both are transparent, there is lack of contrast. There is no contrast. And since there is no contrast, we need staining. We can't see the bacteria directly on a slide. We have to stain the bacteria. And that is the importance of staining. So, what we have learned till now, we have learned there are two types of preparations in bacteriology. The unstained preparation, which are known as wet preparation, and second is stained preparation. Okay, so if you want to see the morphology of the bacteria, I mean the structure, size of the bacteria, okay, you have to stain it if you want to see the morphology. But if you use the unstained preparation, you don't stain it, you can't see the morphology. You can't see the morphology. You can't see the structure, shape, size of the bacteria. You can't see the morphology. But you can see something transparent is moving on the transparent background. Can you see here? I have not stained it. I can see the bacteria are transparent. I can see the background is also transparent. I can see something transparent is moving on a transparent background. Okay, so if we use unstained preparation, we can see the motility. If we use the stained preparation, we see the morphology. And if I want to convert unstained to stained, we can do it with staining. And staining is necessary because of lack of contrast. So many MCQs are hidden on this page. Now, what are the important staining techniques present in bacteriology? In bacteriology, there are 4 types of stains. Frequently, you get question on staining. There are 4 types of stains in bacteriology. What are the 4 types of stain in bacteriology? You can see there is simple stain, negative stain, impregnation stain, and differential stain. These are the 4 types of stain in bacteriology. One by one, we will take it. What is simple stain? What is known as simple? The name itself depicts its meaning. नाम में ही उसका मतलब है. What is simple? It is simple because it gives same color to all bacteria. All bacteria are same. It gives same color to all bacteria. That's why it is known as simple. You can see all bacteria are blue in color. Can you see all bacteria are blue in color? Yes. Okay. The examples of simple stain is methylene blue and basic fustian. You get question on the examples. Mind it. So methylene blue and basic fustian are the examples of the simple stain. Learn the definition, learn the example, learn the diagram. So what basically we are doing here? Basically what we are doing here. So here we are staining the bacteria. We are not staining the background. Appreciate in this diagram. Appreciate in this diagram. We are staining the bacteria with blue color. The background is still transparent. We are providing contrast. We are staining one thing, not the other. Both were transparent. So that is the concept of simple stain. Okay, now come on negative stain. What is negative stain? Why it is known as negative? Negative means reverse, ulta. Negative. What do you mean by negative? Negative means reverse. Mane ulta. It's reverse. So here we will not stain the bacteria. We will stain the background. What is the problem? The problem is that bacteria and background both are transparent. So there are 2 solutions. Either stain the bacteria, not the background, that we were doing there. And here, either the other way, stain the background, not the bacteria. So that is negative stain. In negative stain, we stain the background. We will not stain the bacteria. We are getting it. So see what I will do here. Here I will stain the background with black color. I will stain the background with black color. The bacteria is still transparent. So the transparent bacteria will stand out on a negative background. You get an image-based question on this. You can see this is negative stain. Quickly, you can see the negative stain and appreciate the transparent bacteria over there. Appreciate the transparent bacteria. These are transparent bacteria. Appreciate the background is black. Got it? Yes. So that is the concept over there. And learn the examples. There are 2 examples. India ink, Negro ink. India ink, nigrosin. India ink and nigrosin are the examples of the negative stain. That is the second stain. Coming on the third stain. The third stain is impregnation. Forget microbiology. What is the dictionary meaning of impregnation? Impregnated, impregnation. What is the dictionary English meaning? Impregnation means layering, layer over layer. It's layering, layering. Okay. Now some bacteria are too thin. We can't see them. That is the problem. Let's thick them. Let's make them thick. How we can make them thick? Just a second. How we can make them thick? By giving a covering, by giving a layering. So we are layering it with silver. The chemical formula of silver is Ag. That is impregnation. Impregnation means layering. We are doing layering with silver. It is used for the thin bacteria. Who is the thinnest bacteria? The thinnest bacteria is spirochete. So basically we use it for spirochete or for the flagella. That is the third type of stain. So what we have learned till now? We have learned there are 4 types of stains in bacteriology. Out of them 3 are done. I will come on the 4th one. Is the 3 clear to you? Any confusion in these 3? So what is simple stain? It gives same color to all bacteria. What is negative stain? Here we stain the background. We stain the background. Okay, but we do not stain the structure to be demonstrated. We don't stain the bacteria. We don't stain the structure to be demonstrated. What is impregnation? It is layering, layer over layer. Okay, now you tell me the examples of these. Then I will move on the 4th one. Let's revise the example of these 3. Simple stain, what are the 2 examples? Methylene blue, basic fusion. Fast, methylene blue, basic fusion. Negative stain, what are the examples? What are the examples of negative stain? India ink, nigrosin. India ink and nigrosin is the example over here. What is the example of impregnation? Silver. Silver. Layering with silver. Now let's come on the last one. The last and the 4th one. Differential stain. What is differential stain? The name itself depicts its meaning. Wait. Let me give you the clue. It is opposite of simple. Now you tell me. It is opposite of simple. It is opposite of simple. What is simple? Simple gives same color to all bacteria. Differential, it gives different color to different bacteria. So differential give different color to different bacteria. It gives different color to different bacteria. So that is differential. And there are 3 examples over here. What are the 3 examples of differential stain? Gram stain, Thiel-Nelson, Zaden stain, and the third is Albert stain. You very frequently get question on these 3. One of these 3. Very frequent, almost every year in any exam. Okay, so I will give you the detail of these 3 in much detail. So can we continue? Are you understanding? Yes. So let's start the 3 type of differential stain one by one. The first one is Gram stain. Okay, so let me, before that I'm having some questions. Okay, you read the question. This is not quiz. The quiz will be conducted in the end, based on which we will give the free master chart or prizes. This is just to analyze what you have learned till now. Okay, you have to write down the answer in the comment box. Read the question. Tell me the answer. Read the question. One of the following staining method is an example of negative stain. It is one of the PYQ of NEET PG. Is it Gram stain, Fontana stain, India ink or Thiel-Nelson? What is the correct answer? Yes, of course, the correct answer is India ink. India ink and nigrosin are the examples of negative stain. Next question. Define negative stain. What is the true statement of the negative stain? Read the 4 definition and tell me the correct answer. What is the correct answer? Let me see. What is the correct answer? Yes? Yes. So what is the correct answer? Yes, the correct answer here is B. Absolutely right. So let me read. So the structure to be demonstrated is stained? No. In negative stain, the structure to be demonstrated is not stained. The background is not stained. Background is not stained. No. The background is stained. The background and structure both are stained. No, this is also wrong. But this is right. The structure to be demonstrated is not stained and the background is stained. So correct answer is B, and you frequently get image-based question. So let me come on the 4th and the last one, differential stain. I already told you the definition. What is differential stain? Differential stain gives different color to different bacteria. There are 3 examples. Gram stain, Zaden stain, Thiel-Nelson stain, also known as acid-fast stain. And the third one is Albert stain. So let me start with Gram stain. Let's start with Gram stain. Never forget the basic. People, never forget the basic. Start with the basic. What was my first line in today's session? What was my first line? all bacteria are transparent. You know that? All bacteria are transparent. Can you see a transparent bacteria over here? Say yes. Can you see a transparent bacteria? Can you see a transparent bacteria over here? Yes. On both sides, you can see transparent bacteria. Okay. Now there are 4 steps. 1, 2, 3, 4. 4 steps in Gram stain. And frequently you are asked for sequencing. Please see the 4 steps. Step number 1, use primary stain. You will remember what is primary stain? Primary stain is any stain which is violet in color. It can be gentian violet. It can be crystal violet, but it has to be violet. So if you give a primary stain which is violet color, it will pick the violet color and become violet. It will also pick the violet color and become violet. So now both the bacteria are violet. Step number 1. Step number 2, use a mordant. Mordant is iodine. You say, what is mordant? I don't know what is mordant. Wait. So you can see this was a transparent bacteria. You have given the primary stain which was violet in color. It picked the stain and become violet. But the problem is that it again leak out. We do not want leakage. So basically I want to fix it. So what I will do? I will use a mordant which is iodine. Iodine will go inside and make a complex with the stain. So the stain do not leak out. So the definition of mordant is something that fixes the primary stain. What is mordant? Mordant is something that fixes the primary stain. And who is the mordant here? The mordant is iodine. You get question on that. So here, this is also violet. Violet become fixed. And this is also violet. Violet become fixed. Now, till now, everything is same. Both were transparent. Both are violet. Violet become fixed. Now, step number 3 will bring a change. So step number 3, use decolorizer. What is a decolorizer? Decolorizer is alcohol or acetone, but not acid. We will use acid as decolorizer in the next stain, that is Zn stain. Here we will not use acid. Here we are using alcohol or acetone. Which alcohol? The alcohol which use people as a beverage. The ethanol, C2H5OH. It is also a question. So ethanol is used here as a decolorizer. So now there are 2 types of bacteria. There are some bacteria which are resistant to this decolorizer. They don't allow this decolorizer to enter inside them. So if decolorizer cannot enter inside them, how decolorizer will decolorize them? They are still violet. On the contrary, there are some bacteria which are susceptible to decolorizer. They allow the decolorizer to enter inside them. Decolorizer will enter inside them and decolorize them. They become transparent. You will say, ma'am, why it is the difference like this? The 2 types of the bacteria. Why it's like this? See the cell wall of this bacteria. The cell wall of this bacteria have high peptidoglycan content. See, and peptidoglycan is like a guard. It inhibits the entry of decolorizer. And see the cell wall of this bacteria. They also have cell wall, but in the cell wall they have less peptidoglycan content. Less peptidoglycan content, less guard. So decolorizer can easily enter. So that is the difference. The difference is in the cell wall composition. It is the content of the peptidoglycan that is making the difference. Last step, step number 4. Use the secondary stain or counter stain. Secondary stain or counter stain is red in color. Any stain which is red in color. It can be carbon fustian, it can be saffronin. Red stain is secondary stain, okay, or counter stain. So what will happen? Use your common sense. What will happen? These are full. They don't have any space. They are full. They are not hungry. They will not accept the secondary. They are loyal. They are still violet. On the contrary, they are empty. They are hungry. They are unsaturated. They will accept the secondary stain and they become red in color. So at the end, we have 2 types of bacteria. The violet one, the red one. The violet one are Gram positive and the red one are Gram negative. What I am teaching you? Don't forget, people, what I am teaching you. I am teaching you differential stain. What is the definition of differential stain? Differential stain give different color to different bacteria. Is it proven? Different color to different bacteria. Some bacteria are violet, some are red. So Gram stain is a differential stain. So tell me the 4 steps. What are the 4 steps? Write down. People, what are the 4 steps of Gram stain? Step number 1, use primary stain. Primary stain, that is any stain which is violet in color. Okay, any stain which is violet. Gentian violet, crystal violet. It should be violet. What is the second step? Use the mordant, which is usually used as the iodine. What's the third step? Use decolorizer. What is the decolorizer over here? It can be alcohol, it can be acetone, but not acid, And use secondary stain. The secondary stain is red, like carbol, fuchsin or sulfonate. So please learn the 4 steps of gram stain. It is asked in your exam. Okay, got it? You can see the violet one, gram positive. The red one, gram negative. Appreciate gram positive, gram negative. See the cell wall. See the cell wall here. See the cell wall here. In the cell wall, can you appreciate the composition of the gram stain? Just a second. What happened? Give me a minute. You have to give me a minute, people, to fix it. I don't know how to fix it actually. Give me just 1 minute. I will fix it. In just 1 minute, it will be back. In just 1 minute. I guess I'm back. I'm really sorry. So I was telling you the cell wall. Have a look on the cell wall of the gram positive and gram negative. Appreciate the thickness of the peptidoglycan. People, appreciate this thickness. See the thickness here. See the thickness here. See it is 80 nanometer. See it is just 2 nanometer. The peptidoglycan is like a guard. So here decolorizer cannot enter. Here decolorizer can easily penetrate. That is the principle. You can appreciate. So what we have learned, say, everyone will say. What we have learned there are 2 types of bacteria based on the gram stain. Based on the gram stain, there are 2 types of bacteria. What are the 2 types of bacteria? Gram positive, gram negative. Gram positive are the bacteria that have high peptidoglycan content in the cell wall. These are the bacteria that have low peptidoglycan content in the cell wall. Since they have high peptidoglycan content in the cell wall, they are resistant to decolorizer. Since they have low peptidoglycan content, they are susceptible to the decolorizer. Since they are resistant to the decolorizer, they retain the primary stain. They don't accept the secondary and they are volatile. Yes or no? And since they have susceptible to the decolorizer, they lose the primary. They accept the secondary and they are red in color. Have a look. They are violet, they are red. So that is the 2 types of bacteria based on the gram stain. So you learned the principle, you learned the procedure, you learned the interpretation. Now coming on Zeden stain, Zeal-Nelson stain, the second type of differential stain. Zeal-Nelson stain, also known as acid-fast stain. Zeal-Nelson stain, also known as acid-fast stain. Okay, here also 4 steps. Now you have to tell me the difference between these 4 steps and the 4 steps of the gram stain. You will tell me the difference. What has happened now? So you will tell me the difference, the 4 steps. Let me tell you what are the 4 steps. Never forget the basic. The basic is that all bacteria are transparent. Step number 1. Appreciate a transparent bacteria. Appreciate a transparent bacteria. Okay, both bacteria are transparent. Now use the primary stain. What's the primary stain here? Here the primary stain is red, not violet. In gram stain, the secondary was red. Here the primary stain is red. So here this bacteria become red. This bacteria also become red. What is the mordant? Here mordant is simple heating on the Bunsen flame. Heat the slide on the Bunsen flame. The stain will not leak. It will get fixed. So here the mordant is simple heating. Simple heating on the Bunsen flame. So here red color will become fixed. Here red color will become fixed. Now step number 3, decolorizer. What is the decolorizer here? Here the decolorizer is acid and that's why it is known as acid-fast stain. The decolorizer here is acid. Which acid? Have you read chemistry? You read many acids in chemistry. It's sulfuric acid. What is the chemical formula of sulfuric acid? It's H2SO4. What is the concentration? Mind it. People mind it. You get question on that. So it's 25% H2SO4. Again the same concept. Some bacteria are resistant. They don't allow decolorizer to enter inside them. And that's why they are still red. And some bacteria are susceptible. They easily allow to enter the decolorizer into them. That's why they become transparent. Got it? Now you say, ma'am, why? What is the principle over here? What is the mechanism over here? Again, the cell wall. These bacteria have the cell wall, and in the cell wall they have mycolic acid present. And here mycolic acid is a lipid and it's a guard. It inhibits the entry of the acid, mycolic acid. Its decolorizer will not enter because they are like a guard. On the contrary, they also have the cell wall, but in the cell wall mycolic acid is absent. Other things are present. They don't have mycolic acid in their cell wall. Guards are absent, so decolorizer can enter. So here the principle is again cell wall, but it is not peptidoglycan. It is the mycolic acid. And last, use the secondary stain. The secondary stain is blue. It's not violet. Please appreciate. Violet is different, red is different, blue is different. So your secondary stain is blue, like methylene blue. So use your common sense. These are full. They don't have space. They will not accept the blue. They are still red. They are loyal. They are still red. On the contrary, they are hungry. They are anti. They are unsaturated. They will accept the secondary stain and they will become blue. So at the end, I got two colors of the bacteria. Some are red, some are blue. So is it a differential stain? What is the definition of differential stain? Which give different color to different bacteria. Different color to different bacteria. Some are red, some are blue. The red one are known as AFO, acid fast organism. And the blue one are known as non-AFO. Non-AFO, okay? Non-acid fast organism. They are known as non-AFO. That is non-acid fast organism. So that is the two types of the bacteria we got. You can see the red one, they are AFO. You can see the blue one, they are non-AFO. I hope you got it. What is the principle here? Appreciate the cell wall. In the cell wall, appreciate the mycolic acid. It is a type of lipid present in the cell wall, okay, which is acting like a guard and it inhibits the entry of H2SO4. H2SO4 cannot enter if mycolic acid is present. So that is the principle over here. The principle is again cell wall. So what we have learned, summary, what we have learned. We have learned there are two types of bacteria based on Zn stain, acid fast stain or Zn stain. What are the two types of bacteria? AFO and non-AFO. These are the two types of bacteria. One is AFO, one is non-AFO. AFO are the bacteria which have mycolic acid present in their cell wall. Non-AFO are the bacteria in which mycolic acid is absent in the cell wall. Since here mycolic acid is present, they are resistant to H2SO4. Since here mycolic acid is absent, they are susceptible to H2SO4. Since they are resistant to H2SO4, okay, so they retain the primary, do not accept the secondary, and in the end they are red in color. And since they are susceptible, they lose primary, okay, they accept the secondary and they are blue in color. That is the summary. I hope everyone got it. If there is any confusion, kindly let me know. So people, compare, contrast. Compare, contrast. Gram stain, Zn stain. Compare. Chalo, we will do the comparison. Tell me, this is gram stain, this is Zn stain. Okay? I'm really sorry. Okay. Tell me primary stain in both of them. What is the primary stain here? And what is the primary stain here? Here the primary stain is violet, gentian violet. Here the primary stain is red, carbol fuchsia. What is the mordant here and what is the mordant here? Here the mordant is iodine and here the mordant is simple heating on Bunsen flame. What is the decolorizer here? What is the decolorizer here? Here the decolorizer is acetone or ethanol. Acetone of C2H5OH, alcohol, ethanol. And here the decolorizer is 25% H2SO4. What is the secondary stain? Here secondary stain is red. Okay, carbol fuchsia. And here secondary stain is blue. Appreciate, here primary is red, here secondary is red. Appreciate, here primary is violet, but here secondary is not violet. Secondary is blue. So the one, here the two colors are violet and red. Gram positive, gram negative. Here the two colors are red and blue. AFO, non-AFO. Got it? That is the complete 4 steps of the gram stain and Zn stain. I hope you got the four steps. You got the 4 steps. Tell me the principle. Who will tell me the principle? Here the principle is peptidoglycan content in the cell wall. The one who have high peptidoglycan content retain the primary. The one who have low peptidoglycan content take the secondary. Okay. And here the principle is mycolic acid. If the mycolic acid is present, they retain the primary. If the mycolic acid is absent, they take the secondary. So that is the principle. You know the 4 steps? Yes. You know the principle? Yes. You know the interpretation? Yes. You know the diagrams? Yes. What you don't know? The classification. So let me come on the classification of bacteria based on gram stain and Zn stain. People, wait. What I am telling you? How many bacteria in our syllabus? there are nearly 60 medically important bacteria. I'm not saying total 60 bacteria. There are thousands of bacteria, but out of them 60 are medically important and in our syllabus. I will classify these bacteria according to Brahmstein, the same 60 bacteria, and the same 60 bacteria based on Ziedenstein. The bacteria are same. I will do the classification of same bacteria based on Brahmstein and based on Ziedenstein. You got my concept? Yes. So let me start. Let me tell you the classification of the bacteria first based on Brahmstein. Based on Brahmstein, what we have learned? We have learned there are two types of bacteria. What are the two types of bacteria? The violet one are gram positive. Yes. And the red one are gram negative. Yes. Can you see the two types of bacteria? The violet are gram positive. The red are gram negative. Two types of bacteria. Based on the shape also, there are two types of bacteria. What are the two types of bacteria based on shape? The bacteria which are spherical in shape are known as cocci. The bacteria which are elongated, rod-like are known as bacilli. So this is the classification based on Brahmstein, and this is the classification based on shape. Let's compile the two classification. Let's compile the two classification and make it four. Gram positive cocci, gram positive bacilli. Gram negative cocci, gram negative bacilli. So there are four types of bacteria based on Brahmstein. So because we are compiling two classification, the Brahmsteining and the shape. Now appreciate the shape and the color. Say the shape, it's cocci, it's bacilli, it's bacilli. Can you see? Say the color, violet or red. This is violet, so gram positive. This is red, so gram negative. This is again violet, so gram positive. This is again red, so gram negative. Appreciate. Okay. So GPC, GNC, GPB, GNB. Basics. If you don't know the basics, you can't understand microbiology. So today's session is basics. You should know the 60 bacteria which are coming under each category. Learn the classification. Tomorrow I'm going to start the systemic one. No, I can't start unless and until you know this classification. So you have to learn this classification. In gram positive cocci, we have only two bacteria. Learn the mnemonic SS. Staphylococcus, streptococcus. That's it. Khatam. Do. SS. Okay. In gram negative cocci, again we have two bacteria. Learn the mnemonic NM. Neisseria moraxella. That's it. Khatam. NM. SS, NM. So can I say there are four cocci in the world? Yes. There are four cocci in the world. 2 gram positive, 2 gram negative. Total 4 cocci. Coming on bacilli. So gram positive bacilli. There are 6. These are 2. These are 2. These are 6. 6 gram positive bacilli. I'm having a mnemonic. What is the mnemonic? The mnemonic is A, B, C, D, L, M. This is my mnemonic. A stands for actinomyces, B for bacillus, C for clostridium, D for diphtheria, M for listeria monocytogenes, and M for mycobacteria. Mycobacteria, TB, leprosy, all mycobacteria. Learn the mnemonic A, B, C, D, L, M. Okay? Don't learn this category. Don't you? Because whatever is left will fall in the last category. Common sense. There are 4 categories. You learn first, you learn second, you learn third. Now whatever is left will fall in the fourth one. So remaining all bacteria except these 2, these 6 will fall in gram negative bacilli. Okay, it is the biggest category. Read it casually. Don't try to mug it up. So it contains Enterobacteriaceae, the complete Enterobacteriaceae family. It includes Shigella, Salmonella. Okay, it includes E. coli, Yersinia. Okay, all these bacteria. Vibrio, Pseudomonas, Burkholderia, Haemophilus, Brucella, Bordetella, Legionella, Helicobacter, Campylobacter. I will teach you all these in the next 6 sessions, by the way. Details of each and every bacteria. Apart from these, there are 4 miscellaneous bacteria. Okay, that is Spirochete, Rickettsia, Chlamydia, and Mycoplasma. Why they are miscellaneous? You may be asking, ma'am, why you are not putting in one of the category? Why it is miscellaneous? Why? Why it is miscellaneous? Because they are poorly ground stained. They don't take ground stain very easily. They are poorly ground stained. So ground stain is not a good criteria to classify them. Number 1. Number 2, they are cocobacilli. Sometimes they become cocci, sometimes they become bacilli. So we can't put them in one category. They are pleomorphic. They don't have a fixed shape. That is the reason. So people, basics, learn the classification. Please everyone learn this classification. Okay. So this was the classification based on Brahmstein. So there are 60 bacteria. We classified them based on the Brahmstein into 4 categories. Okay, we will revise in the end. Don't worry. GPC, GNC, GPB, GNB. And I think you know the examples. Okay, now I will classify the same 60 bacteria based on Ziedenstein. I will classify the same 60 bacteria based on Ziedenstein. See the classification. What we have learned? We have learned based on Zeden stain, there are two types of bacteria. What are the two types of bacteria? AFO and non-AFO. Yes or no? We have AFO, non-AFO. Thankfully, scientists have not taken shape over here. We don't take coca and bacilli. So we have only two categories, AFO and non-AFO. Acid-fast organism, non-acid-fast organism. We don't say AFO cocci, AFO bacilli, non-AFO cocci, non-AFO bacilli. Thankfully, we don't say. So we have only two categories here. Okay, we don't have four categories like gram stain. We have only two categories, AFO, non-AFO. So out of all the bacteria we have, all the bacteria, only 5 of them are AFO. We will learn those 5 and we don't learn this category. Common sense. Remaining all will fall here. The remaining all will fall here. So what are the 5 bacteria which are AFO? So not only 5 bacteria are AFO. Okay, along with the 5 bacteria, 3 parasites and 2 fungus and 1 miscellaneous. Total 11 structures are AFO. Among the bacteria, it's 5. Okay. But 3 parasite, 2 fungus and 1 miscellaneous also. Total 11 structures are AFO. So let me enumerate the AFO. Acid-fast structures. Acid-fast organism or acid-fast structure. Among the bacteria, there are only 5. What are 5? I'm having a mnemonic. What is the mnemonic? The mnemonic is no longer separate booking. No longer separate booking for MI phone or my phone, whatever you say. Okay, no longer separate booking for my phone. What does AN stand for? AN stand for Nogardia. L stand for Legionella. S stand for Smegma bacilli. B for bacterial spores. And MI is Mycobacterium. Mycobacterium, TB, leprosy, both. All Mycobacterium. These are the 5 bacteria. Say the mnemonic. No longer separate booking for my phone. Learn the full form. These mnemonics will help you, okay, to retain it better. Okay, now what are the 3 parasites? The 3 parasites are spora, spora, spora. All spora. Isospora, cyclospora, cryptospora. Spora, spora, spora. What are the 2 fungus? The fungus is coccus, coccus. Both are coccus. So rhodococcus, cryptococcus. Both the fungus are coccus. And miscellaneous may we have sperm. Miscellaneous may we have sperm. So that is acid fast. Learn the total 11 structures. Human male sperm. Okay, ova is not acid fast. Sperm is acid fast. So that's why I'm saying acid fast structures. Total 11 structures. I hope you got it. You get many questions over there. One more thing, people. What are the 4 steps of Zeden stain? Have a look. What are the 4 steps? Okay, what is the 3rd step? Third step is decolorizer. Yes. What is the percentage? What is the percentage of H2SO4? It's 25%. This 25 is not applicable for all 11. There are 3 exceptions. Learn the 3 exceptions in which we don't use 25% H2SO4. We use some other percentage. And that's what we call the modification. Modifications of Zeden stain. We are doing modification in the percentage of H2SO4. Okay, over 3 places. Over 3 places we will do. Okay, so now the 3 examples. What are the 3 examples over here? I will mark it here. 3 exceptions. Okay, here in Mycobacterium, both Mycobacterium are there, na? TB as well as leprosy. I told you. Okay, my first exception is Mycobacterium leprae. I don't use 25% H2SO4. I use 5. Just 5% is sufficient. Okay, so 5% H2SO4 is more than sufficient to decolorize them. So we don't use 25. For Mycobacterium leprae, we use just 5. My second example is Nogardia. I don't use 25. I don't even use 5. I use 0.5. 0.5 to 1%. 0.5 to 1% to decolorize Nogardia. It's more than sufficient. And my third and last example is all sporas along with bacterial spores. All sporas along with bacterial spores. I don't need 25. I don't need 5. I don't even need 0.5. I need 0.25. 0.25 to 0.5% H2SO4. You get question on it. Mind it. Learn it. Please. Okay. So these are the 3 exceptions, or these are the 3, you can say, modifications. Okay. And remaining all, whatever left, remaining all are 25%. Remaining all. So Mycobacterium TB is 25%. Okay. Because it is coming in remaining all. So can I say, you tell me, can I say Mycobacterium leprae is less acid fast than Mycobacterium TB? Yes, it is true. But vice versa is not true. You get these as true false. So all the questions are very simple, people, if you understand them. So learn these exceptions. These are the 3 exceptions. So what we have learned till now, people, what we have learned till now, I'm teaching you differential stain. There are 3 types of differential stain, 2 are done. Okay, third one I will teach you now. What 2 are done? First, I told you gram stain. This is gram stain. The basis of gram stain is peptidoglycan content. These are gram positive, which are violet. These are gram negative, which are red. The second differential stain is Zn stain. Okay, here the basis is mycolic acid. Mycolic acid present, they are AFO, which are red in color, and non-AFO, which are blue in color. So see, gram positive, gram negative. Okay, see the basis. Okay, see AFO, non-AFO. See the basis. See the basis. Now we are coming third stain, the last stain, the third and last differential stain, Albert stain. What is the basis here? What is the principle? Here the principle is peptidoglycan content of the cell wall. Here the principle is mycolic acid of the cell wall. What is the principle here? Here principle is not cell wall. Here principle is metachromatic granules. What is the principle? The principle is metachromatic granules. Some bacteria have metachromatic granules. The bacteria which have metachromatic granules are Albert positive and they are green in color. Okay, and the bacteria which don't have metachromatic granules absent in them. Okay, they are transparent and they are known as Albert negative. So here the principle is metachromatic granules, and there are only 5 bacteria which are Albert positive. Remaining all are Albert negative. Only 5 bacteria are Albert positive. Got it? So let's start the Albert stain. The third and the last stain, Albert stain. I already told you the principle. The principle is metachromatic granules. There are only 5 bacteria. And see the diagram. Appreciate the color. People appreciate the color. It's not violet. It's not blue. It's not red. It's green. So Albert positive are green in color. Appreciate the green. Appreciate the green color. It's green. The bacteria are green in color. And appreciate the metachromatic granules are blue in color. These bacteria are metachromatic granules, which are blue in color, but bacteria is green in color. What are the 5 bacteria which are Albert positive? I'm having a mnemonic to learn them. What is the mnemonic? The mnemonic is MSC Garden in Agra. Have you visited Agra? In Agra, there is a garden, MSC Garden. There is no such garden. It is just a mnemonic we have created. Okay. So on the map, there is no such garden. Don't search it. MSC Garden in Agra. So M stand for Mycobacterium. Okay, it is Albert positive. Okay. S for Spirulum volutans, the first bacteria in which it is discovered. The metachromatic granules. S for Spirulum volutans. C is Corynebacterium diphtheria. Garden is Gardnerella vaginalis. And Agra is Agrobacterium tumefaciens. MSC Garden Agra. Okay, now the mnemonic. MSC Garden Agra. Say it again. Say it again. Say, everyone say. MSC Garden Agra. Mycobacterium, Spirulum volutans, Corynebacterium diphtheria, Gardnerella vaginalis, Agrobacterium tumefaciens. Please learn the mnemonic. It will become easy for you to learn. These are Albert positive. So people, we are done with the 3 stains. We are done with the 3 types of differential stain. They are done. Now, you know the principle. I'm not repeating. Okay, you know the colors that based on the gram stain, acid fast stain. Now, you just tell me the classification. Before I come on the next topic, next chapter, you tell me classification. Okay, classification of 60 bacteria. Classification of the total bacteria based on gram stain, based on Zn stain, and based on Albert stain. You just tell me that. Can you help me? Kindly please help me. So here we classify them in 4 categories. What are the 4 categories? GPC, GNC, GPB, GNB. Okay, because we are considering shape also, no? That's why 4. Here we have only 2 categories. What are the 2 categories, people? AFO and non-AFO. Acid fast organism, non-acid fast organism. Albert. Tell me Albert. Albert positive, Albert negative. Enumerate, people. Enumeration is important. Tell me the name of bacteria. Fast. So here we have only 2 bacteria. Staphylococcus, Streptococcus. That's it. Here we have 2 bacteria. Neisseria, Moraxella. That's it. Here we have 6. A, B, C, D, L, M. You know the full form, I assume. And here remaining all. Remaining all will come in this category. So that is gram stain. Come on, acid fast, Zn stain. So here we have 5 bacteria. Okay, what are the 5 bacteria? No longer separate booking amyphone. Nocardia, Legionella, Smegma bacilli, bacterial spores, and Mycobacterium. Remaining all will come here. Along with 5 bacteria, we have 3 parasite and 2 fungus and 1 miscellaneous also. That you know. Currently, we are classifying bacteria. I am interested in bacteria. Now, Come on, Albert. Albert positive are also fine. And remaining all will come in this category. So Albert positive. Name the 5 Albert positive. The mnemonic is MSC, Garden Agra. You know the full form? Mycobacterium, Spirulum, Spirulum volitans, Cornybacterium diphtheria, Gardnerella, Agrobacterium tumefaciens. And remaining all will fall here. So people, the bacteria are same. We are classifying them using different systems. Suppose I ask you a question. Suppose I am asking you a question. What is my question, by the way? My question is Mycobacterium. Mycobacterium tuberculosis. Where it is lying based on Brown stain? Where it is lying based on Zeden stain? Where it is lying based on Albert stain? Can you classify, please? Based on Brown stain, I will say it is gram-positive bacillus. Based on Zeden stain, I will say it is AFO. And based on Albert stain, I will say it is Albert positive. So likewise, we can do for all bacteria. And you get many questions on that. This is the basics. If you don't know the basics, how you will bring the foundation over that? So basics should be strong, that I believe. Got it, everyone? So the staining is done. 4 types of staining. Can we revise it quickly? There are 4 types of stains. People, what is simple stain? It will give same color to all bacteria. Who's attending session from the beginning? Please write down. What is simple stain? It gives same color to all bacteria. What is negative stain? Here, the background is stained, but the structure to be demonstrated is not stained. What is impregnation? Impregnation means layering, layer over layer. And what is differential stain? It gives different color to different bacteria. Say the examples. Quick, fast, we will revise. So here we have methylene blue and basic question. Here we have India ink and Negrosan. Here we have silver stain, and here we have 3 stains. Gram stain, Zeden stain, Albert stain. We have seen the steps, principle, interpretation, diagram, and classification of all these. And you know each and everything. The topic is completely covered. Whatever exam you are targeting, you are 100% prepared for staining. Okay. Now before I end staining and I start the next topic, I would like to tell you one last thing. Bipolar stain. You will say, ma'am, is it 5th type of stain? No, it is not. If it was a 5th type of stain, I must have added it. No? I have not added. It is not the 5th type of stain. It is not a stain. It is a pattern of stain. It is not a type of stain. It is a pattern of staining. You will say, ma'am, what do you mean by pattern of staining? Listen, see this diagram. If I am staining any bacteria, suppose this is the bacteria. Okay. If I am staining any bacteria, okay, if I am staining, don't go on the color. Okay, it can be Gram stain. It can be Zeden stain, it can be Albert stain, it can be simple stain, it can be blue, red, green, violet, any color. But the pattern is uniform. Mind the pattern. Don't mind the color and stain. It is uniform. It is uniform everywhere. The pattern is uniform. So I'm expecting this. So all bacteria do like this. All bacteria in all stain. It can be violet uniform, blue uniform, red uniform, green uniform, but there are 5 bacteria which are exception. In 5 bacteria, whatever stain you give them, whatever whether it is Gram stain, Albert stain, Zeden stain accumulate at the pole. The stain accumulate at the pole. Stain do not distribute uniform. Stain accumulate at the pole. Have you seen the structure? That's why it is known as bipolar staining. North pole, south pole, 2 pole. That's why known as bipolar staining. See the structure. This is known as safety pin. I guess everyone have seen this. So is it looking like this? In safety pin also the poles are filled and the center is empty. So that's why it is known as safety pin appearance. Bipolar staining also known as safety pin appearance. Bipolar staining also known as safety pin appearance. So here the stain accumulate at the pole. It is not uniform. In all stains it is there. So there are only 5 bacteria in which this happens. These are the 5 exceptional bacteria. See this image coming in exam. Appreciate the bipolar staining. Appreciate the bipolar staining. The safety pin appearance. What are the 5 bacteria? I'm having a mnemonic for you. What is the mnemonic? The mnemonic is can produce very high yield. You can learn safety pin can produce very high yield. We use safety pin at multiple places. No, safety pin can produce very high yield. That is the mnemonic. So C stands for Campylobacter granulomatous. Okay. P stands for Pseudomonas, but it's not Pseudomonas aeruginosa. Okay. It's Pseudomonas malae or Pseudomalai. It's not aeruginosa. V for Vibrio, but it's not the main hero. It's not Vibrio cholerae. It's side hero. Okay. It's Vibrio paramyreticus. X for Haemophilus. Again, it's not main hero. It's not Haemophilus influenzae. It's Haemophilus ducrei. And why for Yersinia? Yersinia pestis. Okay. So what we have learned? We have learned there are 5 bacteria which shows bipolar staining. The mnemonic is can produce very high yield. Again, say with me. Say. So please learn it. Say the mnemonic. Can produce very high yield. Out of which, this is the main hero, this is the main hero. The remaining 3 are side heroes. This is Campylobacter granulomatis, Yersinia pestis. But this is Pseudomonas, not aeruginosa. It's Malai or Pseudomonas. This is Vibrio, not Cholerae. It's Vibrio parahemolyticus. This is Haemophilus, not influenzae. It's Haemophilus ducrei. Because the main heroes also come in your options. That's why I'm asking you to mind it. Okay, got it? So we are done with this topic. People, I'm having some MCQs for you. Please write your answer in the comment box. Please write your answer in the comment box. Okay, the first question is in front of you. Read the question, tell me the answer. Can you arrange? Okay, leave this question, just a minute. Albert stain is used for. Can you tell me Albert stain is used for? Albert stain is used for Staphylococcus, Corynebacterium diphtheria, Clostridium perfringens, or Clostridium tetani. What is the correct answer? Apply the mnemonic. What is the mnemonic? The mnemonic is MHC Garden Agra. What is coming in the mnemonic? C for Corynebacterium diphtheria. So the correct answer is B, and you all are right. No, it's not C, Devan. It's B. And everyone else is right. Very correct. The correct answer here is B. Very good. Okay, apply the mnemonic. Apply the mnemonic. The next question. Please mind the question. Don't run. It's tricky. I'm warning, it's tricky. Don't run. Don't rush. So read the question. So mind the word modified. Modified Zn stain is used for. Modified. Modified. Let me see who is correct. Modified Zn stain is used for. What's the correct answer? What's the correct answer? Yes, most of you are correct. I'm asking modification. Modification means exception. I told you 3 exceptions in the percentage of H2SO4. Na? What were the 3 exceptions? Mycobacterium lepra, in which 5%, nocardia and sporas. So answer will be nocardia. What is the answer here? The answer is nocardia, where we use only 5% H2SO4. I'm sorry, 0.5% H2SO4, not 25%. If I remove, so correct answer here is nocardia. Okay, you can appreciate 0.5 to 1% in the nocardia. Got it? If I remove the word modified, and the remaining question is same, Zn stain is used for, then answer become all of them. Then answer become all of the book. So you have to mind your question in that case. Okay, got it? So can we move on the second topic? Was the first topic interesting? Till now my speed was just normal. Now I will accelerate it. Okay, so I guess the warm up is already done. Now we will fly. Okay, with full speed. So give me a minute. I will come on the second topic. So let's start the second topic. Okay, the second topic is the morphology of the bacteria. You get many questions over there. So let's start the morphology. Cell wall, capsule, flagella, fimbriae and spores one by one. Let's start with cell wall. The first is the cell wall. Quickly we will cover this. Then we have to come on the genetics, antimicrobial susceptibility test. Okay, all these topics we will cover today only. Bacterial growth curve, the complete general microbiology we will cover. So coming on the next topic. The next topic is cell wall. Cell wall. You know all bacteria have cell wall. How many of you know that? All. God has given cell wall to all bacteria except one. God forgot to give cell wall to one bacteria. What's the name of that bacteria? That's mycoplasma. Yes, you are correct. It's mycoplasma. So mycoplasma is the bacteria in which cell wall is absent. Rest all the bacteria have the cell wall. Right or wrong? Yes. So let me tell you the structure of the cell wall. All bacteria, whether gram positive or gram negative, they have the cell wall. And cell wall is made up of peptidoglycan. All cell wall have peptidoglycan. The remaining structure may be different, but all cell wall contain peptidoglycan. So first let's study the structure of the peptidoglycan. Peptidoglycan is a polymer. It's a polymer. It is made up of 2 monomers. What is the 2 monomer? NAM and NAG. What is NAM and NAG? N-acetyl glucosamine, that is NAG, and N-acetyl muramic acid, that is NAM. I guess everyone know the full form of NAM and NAG. So it is alternate arrangement. 1 NAM, 1 NAG. 1 NAM, 1 NAG. It's like this. You can see 1 NAG, 1 NAM, 1 NAG, 1 NAM, 1 NAG, 1 NAM. It's alternate. And this is how the peptidoglycan is there. In peptidoglycan, there is alternate NAM, NAG, NAM, NAG, NAM, NAG. This is how peptidoglycan is made. I will draw it. Okay. This is the bacteria. Say yes. This is the cell membrane of the bacteria. Now let me draw the cell wall over it. Okay, how I will draw the cell wall? How I will draw the cell wall? I will draw one knob. 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 Likewise. Okay, this is the first row. This is the first row. Let me finish the first row. Suppose. Okay, now let me draw the second row. In the second row again, I am having knob, 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 knob. Likewise. Okay, likewise. This is the second. We are having the third row. We are having the fourth row. My question to all of you. What is my question to all of you? My question is, how the first row is connected with the second row? They will disintegrate if they are not connected. This is the first row. This is the second. This is the third. There are thousands of the row. They will disintegrate from each other. No, no, no. We do not want disintegration. We have to connect them. Connection is known as cross-linking. So we have to do the cross-linking. How the cross-linking is done? I will tell you. Okay. For cross-linking, the NAM, not NAG, NAM, have a tetrapeptide tail. The NAM molecules have tetrapeptide tail. The NAM, they are connected with each other. They are connected with each other. And this is known as cross-linking. For cross-linking, an enzyme is required. The name of the enzyme is transpeptidase. This is how cross-linking takes place, and this is how the integrity of the cell wall takes place. Okay. Now for cross-linking, two things are there. Actually, two things. You can see the cross-linking. You can see this is gram-positive bacteria. Appreciate it. You can see this is gram-negative bacteria. Appreciate the alternate NAM in both of them. Appreciate first row, second row. Appreciate first row, second row. Now see the cross-linking. I'm interested in cross-linking. Okay. So in gram-negative, appreciate the tetrapeptide chain. The tetrapeptide chain of the NAM. The tetrapeptide chain of the NAM. That is doing the cross-linking. That's it. That's it. But in gram-positive bacteria, two things are doing cross-linking. One is tetrapeptide chain. One is tetrapeptide chain. I agree. One is tetrapeptide chain of the NAM. The other is pentaglycine bridge. Two things are there. Pentaglycine bridges are also there. So point is that cross-linking occurs here also, here also. But in gram-negative, only tetrapeptide chains are doing the cross-linking. I will show you a video also. In gram-positive, along with tetrapeptide chain, pentaglycine bridges are also there. The same thing is written in front of you. Read it, appreciate it, learn it. Okay, what I am saying? I'm saying in gram-negative, only tetrapeptide chains are doing the cross-linking. I have shown you. Appreciate it there. And in gram-positive, along with tetrapeptide chains, we are having pentaglycine bridges also, which are doing cross-linking. Appreciate it here. Appreciate it here. You get questions on that. Please learn it. See this video. Okay. See, this one is NAG, this one is NAM, this one contains tetrapeptide chain. From the cytoplasm, it is moving in the cell wall. And this is cross-linking. Appreciate this is the enzyme, transpeptidase, which is coming and doing the cross-linking. Got it? Have you heard about the antibiotic in pharmacology? The name of the antibiotic is beta-lactam. I guess everyone have heard it. Beta-lactams. What are beta-lactams? Penicillin, cephalosporin, monobactam, carbapenem. These are known as beta-lactam. What is the mechanism of action? How does they act? How does they kill the bacteria? They inhibit the cross-linking. They inhibit the cell wall synthesis. How does they inhibit the cell wall synthesis? Basically, they inhibit the enzyme transpeptidase. They inhibit the enzyme transpeptidase. No transpeptidase, no cross-linking. No cross-linking, the cell wall will disintegrate and the bacteria will die. Okay, the bacteria will rupture and die. So this is the mechanism. I'm just correlating the pharmacology with microbiology. Got it? So you can see here, I will tell you the mechanism of action of beta-lactam antibiotics. So beta-lactam antibiotics inhibit this enzyme, transpeptidase. No transpeptidase, no cross-linking. Got it? So this is the structure of the peptidoglycan. Now, let me tell you the detailed structure of cell wall of gram-positive and gram-negative bacteria. The detailed structure of gram-positive and gram-negative. Got it? So in gram-positive, CCC, I will draw it here. See, this is a gram-positive bacteria, say yes. This is a gram-negative bacteria, say yes. See the cell membrane in both of them. I guess you can appreciate the cell membrane. Now let me draw the cell wall over it. I will draw the cell wall over it. So in gram-positive, only two things are there. Only two things are there. Gram-positive mein. Gram-negative mein four things are there. I will draw two things here. I will draw four. Four names. Five things over there. So gram-positive mein what are the two things? Number one, it is having peptidoglycan. A thick peptidoglycan. Alternate NAM like this. Alternate NAM like this. So this is peptidoglycan, number one. And number two, it is having teichoic acid. This is teichoic acid. Number two, it is having teichoic acid. That's it. Peptidoglycan, thick layer, and teichoic acid. And you know the cross-linking also. You know the cross-linking in the peptidoglycan is by two things, tetrapeptide chain and pentaglycan bridge. Tetrapeptide chain and pentaglycan bridge. You know that. Now let me come on gram-negative cell wall. Let me come on gram-negative cell wall. Listen, people listen. What I told you, what is this? See ma'am, this is cell membrane. This is plasma membrane, cell membrane. Okay, in the cell wall of gram-negative, there is one more plasma membrane. Yes, there is one more cell membrane. In the cell wall, there is one more cell membrane or plasma membrane, and that is known as outer membrane. That is known as outer membrane. The space between the two is known as periplasmic space. Periplasmic space. In this space, there is peptidoglycan, but that is very thin. Only 2 nanometer. Here it is 80 nanometer, 80. Here it is 2, just 2 nanometer. So here peptidoglycan is there in the space, but that is thin. Here it's thick, here it's thin. Here the cross-linking is by both tetrapeptide chain and pentaglycine. Here the cross-linking is by tetrapeptide chain only, no pentaglycine. Okay, got it. After that, there is connection of the peptidoglycan with the outer membrane. The peptidoglycan get connected with the outer membrane with the help of lipoproteins. These are lipoproteins. What are these? Lipoproteins. And finally, the last thing, lipopolysaccharide, the endotoxin. This is lipopolysaccharide, also known as endotoxin. So this is the structure of cell wall of gram-negative bacteria. I hope everyone got it. Now you will get this diagram in your exam for labeling. Very frequent you get it for labeling. Now you can understand it well. Okay, appreciate it. Try to appreciate it. I will show you. Just a second. Okay, so you can see this is the cell membrane. This is the cell membrane. Appreciate the cell wall over it. Okay, so here you can see this one is peptidoglycan. Okay, and this one is teichoic acid. Appreciate the teichoic acid. Peptidoglycan and teichoic acid. And here you can see this is cell membrane. One more cell membrane. This more cell membrane is known as outer membrane. The space between the two is known as periplasmic space. In this space, appreciate the peptidoglycan, which is very thin, and appreciate the lipoprotein. The lipoprotein connecting the peptidoglycan with the outer membrane, and appreciate the lipopolysaccharide. Endotoxin. This is lipopolysaccharide. I hope everyone got it. So you get this for the labeling in your competitive exams frequently, or in your university exam you are asked to draw it. I guess you are able to do so now if you have understood it. Okay, so what we have learned, people, tell me. So tell me the difference in the cell wall and gram-positive, gram-negative. Summary. If you have understood, very good. If you have not understood, learn the summary. Tell me the summary. Who will tell me the summary? Here also we have peptidoglycan. Here also we have peptidoglycan. Yes, yes. But here the peptidoglycan is thick, 80 nanometer. Here the peptidoglycan is thin, that is 2 nanometer. Got it? Here the cross-linking is tetrapeptide chain and pentaglycan bridge, both. Here the cross-linking is only tetrapeptide chain, no pentaglycan bridge. Got it? Now tell me the unique features. Unique features. Here we have teichoic acid, but here we don't have it. Here we have outer membrane, periplasmic space. In the periplasmic space, we have peptidoglycan, that's I have written. We have lipoprotein and lipopolysaccharide. So learn the thing which is common, learn the things which are unique, and try to draw it. Try to draw it. The same difference table in front of you. Read it, appreciate it, understand it. You will be able to solve all the questions over there. Can we go ahead? Yes. Now, the next thing is CWD. Okay. I told you all bacteria have cell wall. Tell me the bacteria who don't have cell wall. One bacteria who don't have cell wall. The God has not given cell wall to only one bacteria. Name that bacteria. What is the name of that bacteria? Mycoplasma. Okay. But artificially, we can remove the cell wall in many bacteria. And the cell wall deficient bacteria are known as CWD. What is the full form of CWD? Cell wall deficient. CWD. Cell wall deficient form. See, this bacteria have a cell wall. Appreciate. If artificially I remove it, I will get a CWD. This is known as CWD. Okay, so natural CWD is only one. That is mycoplasma. But artificially we can create it. Okay, say ma'am, how artificially you can remove the cell wall? How? Artificially we can remove the cell wall using beta-lactams. I told you, beta-lactams. Beta-lactam are the antibiotic who disintegrate the cell wall. I told you, or else we can use the lysozymes. Lysozymes are the enzymes who degrade the cell wall. So we will get the cell wall deficient form. Now 4 questions, 4 answers. People, 4 questions, 4 answers. Please understand it. Please understand it. Tell me, everyone tell me, a natural bacteria which is CWD. A natural bacteria, I guess everyone knows the answer. A natural bacteria which is CWD is mycoplasma. Many times you told me. Okay, yes, it's correct. But now you tell me a artificial bacteria, a artificial gram-positive bacteria in which artificially the God has given the cell wall, but artificially me, human, I have removed it. Either using beta-lactam or using lysozyme. I have removed it. What it is known as? Tell me a artificial gram-negative. This was gram-positive. This was gram-negative. Okay, a bacteria in which God has given the cell wall, the great God, given cell wall, but me, human, have removed it artificially, either by beta-lactam or lysozyme. What it is known as? What it is known as? Okay, once the cell wall is removed, suppose here the cell wall is removed, here the cell wall is removed. Suppose the cell wall is removed, the bacteria will burst. They are very unstable. They will burst and die after removing the cell wall. What they are known as? So gram-positive bacteria are known as protoplast. What they are known as? Protoplast. And gram-negative bacteria are known as spiroplast. You get question on them. Okay, so protoplast, spiroplast. This is artificial gram-positive unstable, CWD. This is artificial gram-negative unstable, CWD. Got it? Now tell me the last one. It can be gram-positive, it can be gram-negative, but the God has given the cell wall. We human have removed it, but unknowingly, strangely, after removing the cell wall, it's still stable. This one was unstable. This one was unstable. Ye to natural hai. This one is stable. What it is known as? It is known as L form. Frequently you get the question, make a 5-star. L form. What is L known as? L is lister. L ka mane kya hai? L mane lister. Lister is the scientist? No. Lister is not the scientist. Lister is the institute in Paris where it is discovered. It's a question. It's not scientist. The scientist is Klimberger who discovered it. So it is known as L form. And you get question on that. Got it? So see the 4 questions, 4 answer. People, see the 4 questions, 4 answer and mind it. Please mind it. Okay. So you can see the natural CWD. Answer is mycoplasma. See the artificial gram-positive unstable CWD. Answer is protoplast. See the artificial gram-negative unstable CWD. Answer is spiroplast. And see the artificial, maybe gram-positive, maybe gram-negative, but the point is stable CWD. Answer is L form. Please learn it. The same thing is written in front of you. Read it. In the form of the text, it will be difficult. In the form of the diagram, it will be easy to understand. So please learn it and you get questions on that. Okay. Now the next topic, capsulated bacteria. How many bacteria have capsule? There are, I told you, many bacteria in our syllabus. Okay, more than 60 bacteria I will teach you in the next 6 sessions. Okay, I will teach you all of them. But only 9 of them are capsulated. Out of these important bacteria, 9. You have to learn these lucky 9s. You have to learn the name. Along with 9 bacteria, 1 fungus is also capsulated. So you can say total 10 organisms are capsulated. Give me a mnemonic to learn these. Before I start the bacteria tomorrow, you must be ready with the list. You should know which bacteria are capsulated. So I'm having a mnemonic to learn that. What's the mnemonic, people? What's the mnemonic? Mnemonic kya hai? The mnemonic is yes. Yes. Very killer bacteria have pretty nice capsule. Say the mnemonic first. The mnemonic is yes. Say it. Yes. Very killer bacteria. Very killer bacteria have. What does they have? Have pretty nice capsule. B double, C double. Counted. Thus 10. They are 10. Now learn the full form. First learn the mnemonic, then learn the full form. So Y stand for your senior. You have to learn it. B for Vibrio, but mind it. It's not Coleri. Coleri is not capsulated, people. Vibrio parahemolyticus is capsulated. You get question on that. K for Klebsiella. Okay, B, double B. There are 2 B. So here we have Bordetella and Bacillus. We don't have Brucella. Total, there are 3 bacteria which start from the letter B. Brucella is not coming here. Brucella is not capsulated. But Bordetella and Bacillus anthracis is capsulated. Got it? H is Haemophilus influenzae. P is Pneumococcus. N is Neisseria. But Neisseria meningitis, not Neisseria gonorrhoeae. Mind it. It's meningitis. And C means Clostridium. But not all Clostridium. Perfringens and Butyricum. Only 2 Clostridium. And one more thing you can add, that is Cryptococcus. Cryptococcus is the fungus. Okay, the 9 bacteria and the 1 fungus. Learn the capsulated organism. I'm not repeating the list. Please learn it. Okay, now my next question. Can you walk? See, of course. See, I can walk. I can walk, of course. You can walk, of course. Everyone can walk. Okay, how we can walk? Thankfully, the great God has given us legs. Yes or no? The great God has given us legs. So legs, our legs, are our organ of locomotion. Yes or no? We have 2 legs. All of us have 2 legs, and that too on the lower portion of the body. My next question. Can bacteria walk? Can bacteria walk? Huh? Not all. Not all bacteria are lucky like humans. Okay. Only 12 of them can walk. Only 12 of them can walk. How many can walk? Only 12 of them. Because God has given legs to only 12 of them. The 12 lucky bacteria are motile. Remaining are non-motile. You are getting my point? So, the leg of the bacteria is known as flagella. The leg of the bacteria is known as flagella. Appreciate the flagella. So flagella is the organ of locomotion. Okay. So what is the flagella? You can see flagella is the organ of locomotion, organ of motility in the bacteria. This is flagella. See the structure of the flagella. The bacteria who have flagella, they run from here and there. There are 12 bacteria which are motile. Before I come on these lucky 12 ka list at the tip of your tongue, before I come on that, let me tell you the types of flagella. Flagella is the organ of locomotion or motility. Let me come on the types of flagella. There are 2 types of flagella. I told you God has given human only 2 legs, but flagella ka number is not fixed. They can have any number, not 2 legs, many legs. Okay, the location is also fixed on the lower side of the body. We don't have legs here, but bacteria can have legs anywhere. Okay, so that is the classification of the flagella. Let me draw it. There are 2 types. There are 2 types of flagella. What are the 2 types of flagella? This is the bacteria. This is the bacteria. Okay, here let me draw the 3 types. Here, the flagella is all around. Imagine the leg is all around the body. All the periphery, multiple legs. This is known as peritrachus. What is known as? Peritrachus. Because it is periphery. Peritrachus flagella. Here, we have only one flagella at one point. One flagella at one pole. Okay, one flagella. Or multiple flagella but coming out from one point, one pole. Okay, or multiple flagella from the 2 poles. Please appreciate, here the flagella is coming from 1 or 2 points. Here the flagella is coming all the periphery. This is known as polar. This is known as polar. So my point is, there are 2 types of flagella. Peritrachus and polar. Peritrachus don't have any other type, but polar is of 3 types. One flagella at one pole, monotrichus. Multiple flagella, a tuft of flagella at one pole. This is known as lopotrichus. And a tuft of flagella at both the poles. It is known as amphitrichus or bitrichus. Got it? So see the 2 types of flagella. Now, how many bacteria have flagella? How many are the lucky motile bacteria? 12. How many are there? 12. Out of 12, 6 have polar flagella and the remaining 6 have peritrichus. So I will give you 2 lists. One list for polar, learn them, and one list for peritrichus, learn them. I guarantee many questions come from here. So you have to learn these 2 lists. Appreciate the 2 list, people. Appreciate the 2 list. Can you appreciate the 2 list? This is polar flagella. This is peritrichus flagella. Okay, polar and peritrichus flagella. Yes. So polar with the mnemonic is very polar solution, HCl. Okay, V stand for Vibrio, P for Pseudomonas, S for Spirochete, Helicobacter, Campylobacter, bhai, always come together. Helicobacter, Campylobacter, twin brother. Okay, they always come together. And L is Legionella. Please learn the list. You have to learn the list. Okay, today I will give you many mnemonics. By the way, all mnemonics are also given on one page in this master chart. Hang it on your wall. You don't realize when the entire microbiology will be at the tip of your tongue. You just keep on flipping the total 60 pages. You just keep on flipping. In your room, wherever you reside, you just hang it and keep on flipping the pages. Someday, some page, someday, some page. You will remember the entire microbiology without even touching the textbook. It will be there and 100% strike rate. You mark every question in my master charts. Mnemonics are also given, by the way. Okay, chalo, come back. So here, this is the mnemonic. You have to learn. Now coming on, the next, peritrichus flagella. Peritrichus flagella, what is the mnemonic? The mnemonic is cute. C for cute. Just a second. What happened? Just a second. C for cute. B for baby. SLEP, sleep. I know the sleep spelling have double E, but here in mnemonic we have only one E. So C stand for Clostridium, B stand for Bacillus, S stand for Salmonella. Okay. L for Listeria, E for E. coli, P for Proteus. But the first three have exception, exception, exception. Mind, people, mind. Whenever there is an exception, it is the thing you are going to get question on that. Examiners love exception. Whenever there is an exception, please mind it carefully, judiciously. You are going to get question on that. You will not get the question on entire list. You will get the question on exceptions. Okay. So my point is all Clostridia are motile. They can move except one who is not motile. The Raja, the king. King is sitting. Everyone else is moving. Who's the Raja in Clostridium? The Raja in Clostridium is Clostridium perfringens. Okay. All Bacillus are motile except the king. Who's the king? Anthrax. Anthrax sit. Rest all will move. And Salmonella. Okay. All Salmonella are motile except one. Gallurium and Pullorum. Gallurium, Pullorum is not the king, but that is immotile. So learn the list. Say the mnemonics, people. It's easy. It's easy. Okay. So there are total 12 bacteria who are motile. The lucky 12. 6 of them are motile with polar flagella and 6 of them are motile with peritracheous flagella. The 6 which are motile with polar flagella, very polar solution HCl. This is the mnemonic. And here the 6th one which are peritracheous, cute, baby, sleep, SLEP, sleep. This is the mnemonic. 6 plus 6, 12. Learn 3 exceptions over here. Learn 3 exceptions over here. That's it. You want me to say the full form? I will. Okay. So B for Vibrio. Yes. P for Pseudomonas. S for Spirochetes. H for Helicobacter. C for Campylobacter. Bhai, brothers, come together. L for Legionella. L for Legionella. Come this side. All Clostridium except the Raja, perfringens. All Bacillus except the Raja, Anthracis. All Salmonella except Salmonella, Gallurium Pullorum. Gallurium Pullorum. Okay. L for Listeria, E for E. coli, and P for Proteus. Now I want you to mind something. Let me tell you what I want you. I want you to mind. Here we have L. Here we have P. I want you to mind. Here also we have L and P. Examiner knows that. Okay, the one who set your paper that knows that. And always in the option you get 2L or 2P and you get confused. So my point is, people, don't learn the mnemonic. Learn the full form of the mnemonic. Which L is coming here, which P is coming here, which L is coming here, which P is coming here. That is the catch. So I told you the trap. Now to escape from that or not, it's your choice. Got it? Chalo. So that is the thing. Now everyone walks. You also walk, me also walk. See, everyone walks. Everyone walks like this. But there are some person who have some unique motility. You have seen that girl who walks so slowly. Who have seen that boy that take baby steps. Who have seen that girl who take jerky steps. So some people have some unique motility. हिंदी में कहते हैं चाल. Okay, चलते तो सब हैं, but some people have unique motility, unique चाल. Same thing we will apply to these 12 bacteria. All 12 are motile. All 12. They are motile, but 4 of them have unique motility. 4 of them have unique motility on which question comes. So let me tell you the 4 unique motilities. Can I tell you the 4? See the videos. Appreciate the videos. See the 4 unique motility. Okay, see, this is darting motility. So what do you mean by darting? Darting, forget microbiology. English meaning of darting. What is the English meaning of darting? Shooting star. Have you seen a shooting star? What do you mean by shooting star? Hindi में कहते हैं टूटता तारा. टूटता तारा. People take wish from the shooting star. Have you seen a shooting star? It's very fast. Something you cannot trace. It's just visible for a moment and just disappear. That is known as shooting star. So can you see the motility of the bacteria here? You just see it become disappear. So it's like shooting star. Only 2 bacteria shows this. Okay, number 1 Vibrio cholerae, number 2 Campylobacter jejuni. These 2 show darting mortality. Learn darting mortality. Number 1 darting mortality. Number 2 tumbling. What do you mean by tumbling? Tumbling means clockwise, anti-clockwise. So bacteria is like this. A little bit clockwise, a little bit anti-clockwise. Clockwise, anti-clockwise. That is known as tumbling mortality. Only 1 bacteria shows tumbling mortality. Listeria. Listeria monocytogenes. It shows tumbling. Question में tumbling माने listeria. That is the answer. Got it? That is tumbling mortality. The third one is corkscrew. You know what is a screw? What is screw? Have you seen a screw? It's like a screw. This structure. Screw-like. The mortality is like a screw. So one bacteria shows screw-like mortality, that is spirochete. Spirochete. All the spirochetes. You know Borrelia, Leptospira, Trypanosoma. They show corkscrew modality. And the last one is swarming. What do you mean by the term swarming? Huh? You know, fast runners, some athletes who are very fast runners. You know who's PT Usha, Milkha Singh, you know, they're very fast runners. Okay, so like the fast runners, here also in bacteria, we are having some athletes. So what we do, we take one of the fast runner and we will inoculate it on an agar plate. This is our agar plate. This is our agar plate. We are inoculating one of the fast runner on the agar plate. What will happen? They will start running. Since they start running, they will produce waves. They will produce waves over there. And the waves is known as swarming. So 3 bacteria show swarming. What are the 3 bacteria which show swarming? The mnemonic is physics, chemistry, biology. You have taken PCB in your 11th, 12th. That's why you are doctors. Yes, PCB. The mnemonic is PCB. P for Proteus. Both the Proteus. Mirabilis, vulgaris. Proteus. Okay. C for Clostridium. But which Clostridium? Clostridium tetani. Clostridium tetani. B for Bacillus. But which Bacillus? Not Anthracis. It's Bacillus. So please learn. These are the bacteria which show swarming. Learn the list, people. Learn darting. Learn tumbling. Learn corkscrew. And learn the swarming. Swarming is shown by 3 bacteria. P, C, B. Better. You mark it over here only. The 12 bacteria. Mark 4 of them. The one who have unique motility. And it will be easier for you to retain. Any queries till now? Say, is it good to go? Are you grasping? Huh? Are you accommodated or acclimatized with my speed, with my pattern? Tomorrow, don't you dare to miss the tomorrow's session. Tomorrow, you will understand my unique way of teaching the systemic microbiology in tabulated columns, comparative columns. All bacteria, virus, fungus, parasite in one shot, the complete CVS. Don't you dare to miss it. Okay, chalo. We will continue. So flagella is done. Motility is done. I'm having some questions for you. Would you be able to answer? Read the question, tell me the answer. Read the question and tell me the answer. Peritrichus flagella is seen. Peritrichus. Say the mnemonic. What's the mnemonic of peritrichus? Huh? Cute, baby, SLEP. And what's the mnemonic of polar flagella? Very polar solution, HCl. So where is B? B is coming in that side. Where is Campylobacter? That is also coming that side. Where is Legionella? That is also coming that side. But only Proteus is coming this side. So what's the correct answer? You all are right. No, the answer is not. Yes. The correct answer is B. Most of you are right. Very good. The correct answer is B. This is how you have to approach the question. The next question. Bacteria with a tuft of flagella at one end. Draw it. Draw bacteria with a tuft. Tuft meaning cluster. Cluster of flagella at one end. What is this known as? Is it monotriche, peritriche, bipolar or locotriche? What is it? Yes, the correct answer is locotriche. You can appreciate they're asking for this. So they can give you any of the image based question based on the type of the flagella. Now the next thing is the fimbri. What is fimbri? I told you flagella. Flagella start with F. Fimbri also start with F. Flagella is the organ of locomotion. Okay, the legs. Locomotion. Fimbri is not an organ of locomotion. Okay, fimbri is also hair-like. Appreciate it. Flagella is also hair-like. Fimbri is also hair-like. Both are like hair. But flagella is for locomotion. Fimbri is for adhesion. What do you mean by adhesion? This is host cell. Okay, human cell. Host cell. Okay, this is bacteria. Okay, how does bacteria attach with human cell? Have you ever thought? How does bacteria attach with the human cell? How? With the help of fimbri. Fimbri is the organ of adhesion. Fimbri is an organ of adhesion, not locomotion. Fimbri is an organ of adhesion or conjugation. Okay, it's an organ of adhesion. Now the next is bacterial spores. What are bacterial spores? Some bacteria form the spores whenever they are in unfavorable condition. They form spores. You know, the spores are the most resistant resting stage of the bacteria. How many bacteria form spores? There are only 4 bacteria which form spores. The mnemonic is BSc chemistry. Please learn the mnemonics. Today I will give you nearly 10-15 mnemonics, but you have to learn. That is your foundation. And from tomorrow we will apply them. Whenever I will teach you these bacteria, we will revise them. Okay, from tomorrow onwards we are starting the systemic now. So whenever there will be a capsulated bacteria, I will show you the mnemonic. Whenever there is a motile bacteria, I will show you the mnemonic. Whenever there is a spore forming bacteria, I will show you the mnemonic. And you don't realize when you will remember all the mnemonics. Got it? So retrospectively, in the next 6 days, these mnemonics we are going to see many times in front of our eyes. Got it? Chalo. So BSc chemistry. B stands for Bacillus anthracis. S stands for Sporosarcina, rare bacteria. I will not teach you this. C for Clostridium. One more C for Coxella burnetii. Okay, these 4 bacteria are spore forming. We are done with next topic also. Can we revise it quickly? People, are you with me? Can we revise it? Tell me, you tell me, capsulated bacteria. How many bacteria are capsulated? You tell me spore forming bacteria. How many bacteria are spore forming? And you tell me motile bacteria. How many bacteria are motile? First you tell me the numbers. People, be fast, quick. So capsulated bacteria are 9 with 1 fungus. So total will be 10. Yes, 9 plus 1, 10. Here spore forming are 4. 4 bacteria form the spore. And motile bacteria are 12. 6 plus 6. 6 by polar, 6 by peritragus. Now say the list. Say the list fast. You may be thinking that ma'am is bombarding with so many mnemonics. It's boring. But believe me, in the next 6 days, I will show you these mnemonics itni baar कि कोई नींद से भी उठा के पूछेगा ना, you will learn these mnemonics. It will be at the tip of your tongue. Without your efforts, it will be effortless. Okay, efforts will be mine. You don't have to put any efforts. You have to be attentive during the session. You give me 25 hours, just 25 hours. I will give you gold, distinction or 100% strike rate in your competitive exam in microbiology. That is my guarantee. Okay, chalo, come back. Capsulated bacteria. Tell me the 9 capsulated bacteria. What's the mnemonic? Yes. Very killer bacteria have pretty nice capsule. Yes or no? So here we have double B, here we have double C. Count, they are 10. Count, they are 10. Spore forming bacteria. BSc chemistry. BSc chemistry. Spore forming bacteria. Tell me the 12 bacteria which are motile. 6 polar. First tell me 6 polar. Very polar solution HCl. Very polar solution HCl. You can correlate polar with the polar. Okay. Now come on, peritragus. Cute. Okay. Baby. Cute baby sleep. SLEP sleep. Mnemonic में कुछ नहीं रखा. Mnemonic are not important. The full form of the mnemonic is important, people. The first step, learn the mnemonic. Second step, learn the full form of the mnemonic. Got it? So please do so. Okay. Now coming on the next topic. The next topic is bacterial growth. Bacterial growth. Bacteria divide by binary fission. How does the bacteria divide? Bacteria divide by binary fission. Can you see this video? You can see one bacteria is coming. It is dividing into two daughter bacteria. This is known as binary fission. First cytoplasm divide, then nucleus divide. Bacteria divide by binary fission. The time required by one bacteria to divide into 2 bacteria is known as generation time. What is generation time? It is the time required by one bacteria to divide into 2 bacteria. That is known as generation time. The generation time is 20 minutes in 99% of the bacteria. Every 20 minutes, bacteria divide into 2. So it is 1 to 2, 2 to 4, 4 to 8, 8 to 16, 16 to 32, 32 to 64, so on. It keep on dividing every 20 minutes, every 20 minutes, every 20 minutes. There are few exceptional bacteria. Okay, for example, Mycobacterium TB. From 1 to 2, it takes 14 hours. And Mycobacterium leprae, it takes 14 days, approximately 14 days. So it can be 14 hours, it can be 14 days also. Learn the exceptions. Otherwise, for 99% of the bacteria, it's 20 minutes. Okay, now I will tell you bacterial growth curve. This is known as bacterial growth curve. There are 4 phases. There are 4 phases in bacterial growth curve. Okay, I will show you the 4 phases. Please understand it. You get many questions from this. It's very important. Okay, I will show you with the help of an experiment. Okay, let's do an experiment. You do it with me. Take a culture media. This is a culture media. By the way, my next topic is culture media only. Take a culture media. What is culture media? Culture media is something in which we provide nutrition to the bacteria. What is nutrition? It's a thali. We eat a thali, na? Suppose it's a veg thali. It contains everything. It contains chapati, rice, vegetable, salad, dessert, water. It contains everything. Okay, it contains a complete nutrition for the bacteria, whatever bacteria require for growth. Okay, and you do inoculation. You do inoculation of the bacteria. What is inoculation? We are putting some bacteria. Suppose I am putting 3 bacteria. Don't go on the number. Number are for reference. Suppose I am putting 3 bacteria. Appreciate the 3 bacteria. What is my expectation? My expectation is that as soon as I put it, 20 minutes, it should divide. Okay, from 3, they should be 6. From 6 to 12, 12 to 24, so on like that. Okay, they should keep on dividing. But what is the reality? Okay, reality is not always matching with the exception, with our expectation. Yes or no? Huh? So reality, they are still 3. Here they were 3. They are still 3. Why? They got everything. They got all the nutrition. They got the optimum temperature, optimum pH. Still they are not dividing. This is known as lag phase. Lag means delay. They are doing delay. In online class, you say, no, ma'am, there is a delay, there is a lag, lag. What do you mean by lag? Lag means delay. Okay, lag. So they are doing delay in division. So why they are doing delay in cell division? They are not doing binary division. They are doing preparation. They are doing preparation. It is known as preparatory phase. First, they prepare themselves. Whatever metabolites are required for the cell division, they are accumulating that. That is known as preparatory phase. Okay, that is known as lag phase. You appreciate the size of the bacteria is increasing. So basically, in the lag phase, they eat, become obese, but don't divide. So number is same, but size increase. So what is the property of lag phase? Same, ma'am, number same, okay, but size increase. This is lag. The first phase is lag. Appreciate the graph. It is lag. Now the preparation is done. Now it's time to run the show. Okay, they start dividing. Have you read mathematics in your childhood? Of course you. In your 7th, 8th standard, you have a chapter logarithm. Have you read the chapter? What is logarithm? Logarithm means exponential growth. Okay. So second phase, they divide like anything. They keep on dividing every 20 minutes. Every 20 minutes they divide. I will show you a video. They will divide like exponential growth. That's why the second phase is log phase. The second phase is log phase. So here, in log phase, the number increases, but size again decreases. Size become normal. Appreciate it. I have drawn it. Appreciate it. So the number increase, but the size normal. Here size increase, number normal. Here number increase, size normal. This is lag. This is log. Lag phase, log phase. Now this is the limited thali. You eat thali in a hotel, in a restaurant. There are two types of thali, limited and unlimited. What was this? This is limited thali. Okay, so one time will arise when it will exhausted. Yes or no? Everything in the thali and all the food present here will it is at the verge of completion. So here the last chapati. I mean, the food, the nutrition which is present, it is limited. It is limited. So what these bacteria will do? They will fight with each other. Darwin's theory, survival of the fittest. They will fight with each other. The one who get the food, that will divide. The one who do not get the food, that will die, and the number balance each other. So total number is constant. Total number is constant. Why it is constant? You can see the total number become constant. It is known as stationary phase. Stationary, also known as plateau phase. Why it is constant? The number which is increasing, the same number is decreasing, and they balance each other because the food is limited. And here it was limited. Here it is exhausted. The food, no chapati, zero thali, pura khali, empty thali. Nothing is there in the thali. What? They all will die. They all will die. So number will decline. Okay, the number will decline. You can appreciate the decline in the number. This is known as declining phase. How many of you got it? So there are 4 phases. People, what are the 4 phases? Who will tell me the 4 phases? So tell me the bacterial growth curve. Tell me the 4 phases. You get 3 type of questions over here. Let me tell you. First phase is lag, then log, then stationary, then decline. The first thing you get labeling. You get the question on the labeling. Let me label it for you. This is lag, followed by log, followed by stationary or plateau, followed by decline. Okay, you get the question on sequencing. You get the question on the labeling. Now the next thing, you get question their reason. Tell me the reason. Lag is preparatory phase. Okay, log is exponential growth. Stationary, the number which is formed, the same number is dying. They balance. Okay, and decline, they are only dying. That is the second question you get. And the third and last and most important question you get over. Tell me their unique features. Here the unique feature is that this one, size is maximum. In lag phase, size is maximum, but number is same. Okay, and this is the longest phase. Among the 4, this is the longest. Lag. Log mein, number is maximum, but size is normal. Since they are dividing, biochemical reactions are applied in log phase. In log phase, we apply all biochemical reactions of all bacteria because they are dividing, no? They are active. They will show the biochemical reaction. Here, since the food is limited, they are fighting. It's an unfavorable condition. Okay, whenever there is an unfavorable condition, bacteria forms spore. So sporulation. Sporulation takes place in this phase. Sporulation takes place in this phase. Okay, and bacteria also form exotoxin. Exotoxin also formation in this phase. And decline may, since most of the bacteria are dying, there are many involutionary forms. Many involutionary forms are there. So that is the graph. You get questions on that. The same thing is written in front of you. Appreciate it. Can you appreciate it? Log phase from 1 bacteria to 2, 2 to 4, 4 to 8, 8 to 16, 16 to 32, okay, 64, so on. This is log phase. Exponential growth. This is known as exponential growth. Okay, learn the properties of each phase. Lag phase, longest phase, preparatory phase. Okay, size become maximum, but number same. Log phase, bacteria again become small, but biochemically active. Okay, and number become maximum. Stationary phase, sporulation, exotoxin formation. And decline phase, involution formation. Okay, I'm having few questions. Read the question, tell me the answer. Maximum size in which phase? Maximum size in which phase? What's the correct answer? Maximum size in which phase? Absolutely right, Aditi. Aditi is first to answer and everyone else is also right. So maximum size is lag phase. You all are correct. Very good. If I change the question, instead of maximum size, if I ask the number, maximum number, can you change your question? Can you change your answer now? In that case, what's the answer now? Instead of size, if I ask the number, please, everyone, answer it now. Why you are not answering? Yes, absolutely right. Absolutely. Again, Aditi is first to answer. So correct answer here in that case will be log. Maximum number. Acha, if I give you two options here also, at the start of the log or end of the log, when is maximum number? Where is maximum number? At the start or at the end? In that case, answer is at the end of the log. You can appreciate it here. Okay, maximum number is not at the start of the log, at the end of the log. At the end of the log. Okay, so this is the answer. These all are your P by Qs. Okay, now the next thing. Based on oxygen requirement. Based on oxygen requirement, how many types of bacteria are there? I told you the classification of bacteria based on Bramstein, based on Zadenstein, based on Albertstein, the same 60 bacteria. Now I'm telling you the classification based on their oxygen requirement. There are 5 types of bacteria based on oxygen requirement. What are the 5 types of bacteria? Obligate aerobe, obligate anaerobe, facultative anaerobe, and microaerophilic. You will say, I guess everyone know what is aerobe and anaerobe. In your school time, 7th, 8th standard, you have read, na? What is aerobe? What is anaerobe? I guess everyone knows from the school time. Aerobe is the bacteria who grow in presence of oxygen. And anaerobe is the bacteria who grows in absence of oxygen. ये तो बच्चों को भी पता है. But what do you mean by the term obligate and facultative? What do you mean by the term obligate and facultative? What is for obligate aerobe, obligate anaerobe? Facultative aerobe, facultative anaerobe. What is obligate and facultative? Obligate, mane, disciplined. They are stubborn. Some people are very stubborn. They are very stubborn. Ziddi, adial. They are non-adjustive. Okay, they are fixed in their terms. They will do this, otherwise they will die. They will not adjust. Non-adjustive people, like non-adjustive bacteria. Obligate aerobe are the bacteria who grow only in presence of oxygen. If you don't give them oxygen, they will die. They don't adjust. They are non-adjustive people. Okay. Similarly, obligate anaerobe, they grow only in absence of oxygen. If you don't give them oxygen, they will grow. But if you give them oxygen, they will die. They will not adjust. They are non-adjustive people. But most of the world is adjustive like us. Okay, so most of the people are facultative. I guess we all are facultative. So we should adjust in adverse condition. It doesn't mean the people who are facultative, they don't have their intrinsic choices. Of course they do have. Okay, we all have our choices. But it doesn't mean if the choice is not fulfilled, we will die. We will adjust in the adverse environment. It's okay. So that is the meaning of the facultative. Now please understand, the facultative and the aerobe are actually aerobe. They like to be aerobe. उनको अच्छा तो oxygen में presence अच्छा लगता है. They are actually aerobe. But if you don't give them oxygen, they are adjusting anaerobically. That's why they are known as facultative anaerobe. And similarly, the facultative aerobe are actually anaerobe. Intrinsically, they like to be anaerobe. They want to grow in absence of oxygen. But if you give them oxygen, they are adjusting. So they are facultative in aerobic environment. And what are microaerophilic? They need oxygen, but not much. They need just 5%. 5 to 10%. 5% oxygen. That's why micro, thoda sa chahiye. Okay, zara sa. So they just need 5% of the oxygen. Now learn the list. Who cares for the people who exist? I don't think the world cares for them. The world cares for the people who are obligate. Yes or no? The most stubborn one. Okay, so I mean to say, that was just a joke. I mean to say you have to learn this list. You have to learn this list. Examiner asked question for these. So there are 4 bacteria which are obligate aerobe. There are 3 bacteria which are obligate anaerobe. Okay, and you have to learn microaerophilic, which are again 4. And 99% bacteria are bichare adjustive. 99. You don't have to learn this list. Kindly don't learn this list. Nobody is going to ask you. Okay, what examiner will ask? Obligate aerobe, obligate anaerobe, microaerophilic. So the 3 lists are in front of you. People, yeah, this is thioglycolate broth. in which we can differentiate the bacteria. Can you see here? The bacteria is growing at the top. At the top. So they are obligate aerobe because maximum oxygen is at the top. They are obligate aerobe. Here they are growing at the bottom. Here minimum oxygen is there. They are growing in absence. No oxygen at the bottom. So they are obligate anaerobe. They are obligate anaerobe. Here they are not growing at the top. I'm sorry. Here they are growing mostly at the top, but they are growing lower side also. Okay, so they like to be aerobe, but they are adjusting anaerobically. So they are facultative anaerobe because they are trying to adjust anaerobically. They are facultative anaerobe. Yes or no? These one are not growing at the top, a little bit below the top, where the oxygen concentration is 5 to 10%. So these are microaerophilic. You get image-based question of the thioglycolate broth. Based on thioglycolate broth, we can differentiate them. Got it? People, got it? Yes or no? Say. Okay? Oh. So this is the list. You can see the list of the obligate anaerobe, and microaerophilic. Appreciate the list. Obligate anaerobe, and microaerophilic. Obligate anaerobe, the mnemonic is can't breathe air. Or you can say CBA. CBA. Can't breathe air. Or you can say ABC. Whatever you want to learn. Learn the full form. C stand for Clostridia, B for bacteroids, and A for actinomyces. Please learn it. Okay. Here nesty pest must breathe. They are obligate aerobe. Obligate aerobe. That's why the mnemonic is nesty pest must breathe. N stand for Nocardia, P for Pseudomonas, M for Mycobacterium, and B for Bacillus anthrax. So nesty pest must breathe. And microaerophilic, the mnemonic is hell. The camp is boring. Hell, the camp is boring. Helicobacter, Campylobacter, bhai, they always come together. They were coming together in polar flagella also, if you remember. Helicobacter, Campylobacter, they always come together. Okay. And boring is Borrelia. Boring is Borrelia. Okay. So please learn these lists. Okay. Now based on temperature, can you classify the bacteria? Based on temperature requirement, there are 3 types of bacteria. Okay. The bacteria which grow below 20 degree, the bacteria which grow between 20 to 40, and the bacteria which grow above 50. Above 50 degree, 50 to 80 degree. Okay. The bacteria which grow below 20 degree in cold, they are cold lovers. They are cold lovers. They are known as psychrophile. Psychro, this is your MCQ. The bacteria which grow 20 to 40, they are mesophile. What is human body temperature? Human body temperature is 37. So mesophile are human pathogens. They cause disease in human because they grow at 25 to 40, that is 37 degrees Celsius. And these are growing at high temperature. They are hot lovers. They are cold lovers. They are heat lovers. They are known as thermophiles. So just learn the names. That's it. Got it? We are done with this chapter also. So since we have started, we have completed 4 big chapters. Now coming on the 5th one. The 5th and the biggest chapter over here, we are starting is culture media. Can I start, people? Are you people there? Show me some energy. Can we start? Please. Huh? So let's start the next topic, culture media. Are you people with me? Keep responding. Chalo. If you have any doubt, kindly text your doubt on my WhatsApp number because it's a rapid revision. Here I cannot attend all the doubts. Okay. So everyone give me a thumbs up. Can we start the next topic? Culture media. Very important. Let's start culture media. What is culture media? As I told you, culture media is a nutrition. Nutrition. Like a thali. We eat a thali, na? Veg thali. So it can be in the liquid form, it can be in the solid form. That is the nutrition. Culture media mani nutrition. What does culture media contain? What is the basal culture media? Acha. If I ask you a question, I will give you one meal every day. What do you want in that meal? So if you ask me this question, I will say you give me veg thali every day. A veg thali is the proportion of adequate carbohydrate, proteins and minerals. Okay. So it contains little bit chapati, rice, vegetable, dal, salad, desserts, water, everything. So I can at least survive. I can at least survive. So similarly, that is known as basal. You are giving me basal nutrition, so at least I can survive. Basal. So what is the basal nutrition for bacteria? What is the basal culture media? So you have to take 4 things. Number 1, without water, no one can survive. You have to give water. Number 1, water. Bacteria also need water. Without salt, no one can survive. Mineral salt. So you have to provide electrolyte, NaCl. Okay, without protein, no one can survive. So you have to provide protein in the form of peptone water. And you have to provide carbohydrate plus fats in the form of the meat extract. If you mix these 4, it will be a liquid. Water is liquid. You dissolve salt in water only. It is liquid. Peptone water is liquid. And meat extract is also liquid. Okay, so this is basal veg thali for the bacteria. Minimum nutrition on which bacteria can survive. And this is known as nutrient growth. What is known as? What is known as? It is known as nutrient growth. It is known as nutrient growth. Okay, it is the minimum nutrition on which bacteria can survive. Nutrient growth, and it's liquid, it's nucleate. So it contains 4 things. Learn the 4 things: water, electrolyte, peptone water, meat extract. Got it? Now I'm adding the 5th thing. What is the 5th thing? I'm adding agar in that. The 5th thing is agar. What does agar provide? I told you this provide this, this provide this, this provide this, this. What is agar? Agar kya deta hai? Nothing. Zero. Agar has zero nutrition. Zero. Anda. Zero. No nutrition. You will say, ma'am, why you are adding that? You are wasting your money. Why you are adding agar? It is having no nutritional value. Zero nutritional value. It is not providing any nutrition, but it is a solidifying agent. It is a solidifying. This was liquid, na? I want to convert into solid. So this is my nutrient growth. It is liquid. You know it contains 4 things. I want to solidify it. So I have to add agar. Okay. How much solidification you want? How much solidification you want? You just want semi-solid, or you just want just solid? Okay. Or you want stony hard. I told you what is swarming. Swarming is the waves produced by fast runners, PCB. The waves. Okay, waves produced here. But it become very hard now. Those waves do not produce. So you want semi-solid, you want solid, or you want stony solid, very hard, so that even swarming is inhibited. How much solidification you want? So that depends on the percentage of agar you are adding. If you add just 0.5% agar, it becomes semi-solid. Okay, if you add 2% agar, it becomes solid. And if you add 6% agar, it becomes stony solid. So even the swarming is inhibited. Got my point? So please learn these 3% on which you get questions in your exam. Learn it. Please mind it. If I'm saying something, you mind it, you have to mind it because it's important. It's already a PYQ. Okay, so learn the percentage. Okay, so how you are converting a liquid media into a solid media, and this is known as nutrient agar. So basically, we have 2 basal media. These are known as basal. Basal means minimum nutrition. They contain minimum nutrition for the bacteria. This one is known as nutrient growth. It is liquid. And this one is known as nutrient agar. Obviously, it's solid. This one contains 4 things. You know what 4 things? This one also contains 4 things plus additional is agar. Okay, and you know the percentage of agar. 0.5%, 2%, 6%. Everyone got it? Say yes. Can we go ahead? Say yes. So this is the basal media. Now, can you survive on the veg thali every day? You will get bored. I will also get bored. I can survive, lekin nahi, we will get bored. We need some extra nutrition also, no? Okay. So that is known as special media. What is known as? This is basal media. Basal media are 2. Nutrient growth, nutrient agar. Basal done. Now coming on special media. Okay. We need special food also every day. So special media. That's 2 bacteria also need. So there are 6 type of special media. What are the 6 type of special media? Enriched media, enrichment media. Mind the difference. They are not same people. Okay, you get confused over here. Mind the spelling. I will tell you the difference. Enriched media, enrichment media, selective media, differential media, indicator media, and transport media. Please learn the 6 types. Please first learn. Then I will tell you one by one. Most of the time you get confused in these 2. Okay, but they have nothing to relate with each other. Okay, let me tell you. Let me come on enriched. You tell me who is rich? Who is rich? What do you mean by the term rich? Who are rich people? Rich people are the people who have the basal thing, and apart from basal they have something extra. I call them they are rich because they have the basal. Okay, but apart from basal they have many things extra. So I will call them rich. So similarly, split the term. Enriched media. This is a rich media. Okay, so it's a media which contains basal. Apart from basal, you add one of the 3 things. You add either ag in this basal. Basal contains what? Basal contains water, okay, salt, peptone water, and meat extract. Okay, apart from basal, if you are adding either ag, or you are adding blood, or you are adding serum, you are adding one of them, not all 3, one of them. This becomes rich. And now you can call it rich media, enriched media. Got it? This is the definition. Now learn the definition. So basal media, when we are adding either blood, serum, or ag, it is known as enriched media. Okay, learn the examples, people. Learn the examples. This is blood agar containing blood. Blood agar contains blood. So obviously it will become an example. What does chocolate agar contain? Blood agar contains blood. Chocolate agar contains chocolate? No, it's a joke. Chocolate agar don't contain chocolate. Then why it is known as chocolate? Because it is heated blood. Once you heat the blood, RBC gets rupture. The hemoglobin will come out, and the red hemoglobin will convert into brown pigment. It will convert into brown, the chocolatey color. Have you seen the chocolatey color? So since the color becomes chocolatey, it's known as chocolate agar. So it also contains blood only. This is blood agar and this is heated blood agar. Heated blood. So blood. Okay, this contains blood. This contains heated blood. And the third example is Loeffler's slope. Loeffler's slope, mind it. It contains serum. It contains the fourth example, you can add ag agar. It contains ag. So these are the examples of enrich. You get questions on examples. Now, please see the next two. People, everyone here, see the gadgets. Please see. Enrich have nothing to do with enrichment. Only spelling, matching. Otherwise, enrichment has nothing to do with enrich. Enrichment and selective are same. They are same. Only a minute difference. I will explain. Enrichment and selective are same. Listen, I'm having a wish. Can you fulfill it? Wait. Let me ask it before you comment. Let me ask. See the specimen. This is a mixed specimen. Listen my wish first. This is a mixed specimen. It contains many type of bacteria. Can you see three colors I have shown you? Red, green, blue. A, B, C. Let's call them A, B, C. Many types of bacteria it contains. It can be more than that. Okay. Now my wish is that I want to grow one of them. Suppose I want to grow the red, not blue, not green. I want to grow A, not B, not C. Can you do it for me? That is my wish. So ma'am, how it is possible? If you do inoculation, whether on solid or on liquid, they all will get nutrition together. So they all will grow. Because you will do the inoculation, they all will reach here. No? They all will get the food. They all will divide every 20 minutes. How it is possible to grow one of them, not others? If they are present in a mixed specimen. Now do something for me. No? Karo koi jugaad. You can do something for me. Some adjustments you can do. Wait. We can do so. Let me tell you the solution. Okay, let me tell you the remedy. So before you do the inoculation, in these media, you add the stimulatory substance for the bacteria of your choice, the bacteria you want to grow. You add stimulatory substance. And you add inhibitory substance for the bacteria you do not want to grow. So you add stimulatory substance for A and you add inhibitory substance for B and C. Okay, now you do the inoculation. Now you do the inoculation over here. You do the inoculation over here. Only A will grow. B, C will not grow. So solution har cheez ka nikalta hai. If you want actually. Got it? So this is known as selective or enrichment media. So if it is a liquid media, it is known as enrichment. And if it is a solid media, it is known as selective. So enrichment and selective are same. Only their physical state is different. Okay, both of them contain stimulatory and inhibitory substance. Both of them contain stimulatory substance and inhibitory substance. Okay, but the liquid is known as enrichment and selective is known as solid. As for S you can learn. Everyone got it? Yes? Yes, absolutely right. So see the definition now. You will understand. What is enrichment? It contains stimulatory and inhibitory, but a liquid. Stimulatory and inhibitory in a liquid medium. See the examples. People, you get MCQ on example, not definition. Definition you have to read for second prof university exam. But examples you have to learn for your competitive exam. Okay, got it? See, selenite have broth, tetrathianate broth and alkaline peptone water. Broth माने liquid. Broth का मतलब होता है liquid. Selenite have broth, tetrathianate broth and alkaline peptone water. Got it? Selenite have broth is for Shigella. So it contains stimulatory substance for Shigella and inhibitory for others. Okay. Similarly, tetrathianate broth is for Salmonella. It contains stimulatory for Salmonella and inhibitory for others. Okay. So only Salmonella will grow, others will not grow. And alkaline peptone water, you get question on that. APW. Alkaline peptone water is for Vibrio. It contains stimulatory substance for Vibrio cholerae and inhibitory for others. All are liquid. So they are example of enrichment. Learn the media, learn the corresponding bacteria. You get questions. I'm warning you get questions. Please learn it. Got it? That is enrichment. Now coming on selective. The definition is same. It also contains stimulatory and inhibitory. But it is solid. It is not liquid. It is solid. Now I told you have 60 bacteria in your syllabus. Now you should know the selective media of each and every bacteria at the tip of your tongue. So this is a list in front of you. I'm not reading the list right now. I'm not reading because from tomorrow I'm starting the systemic microbiology. I will teach you all these 60 bacteria one by one system wise. So whenever I will teach you, I will tell you the selective media of that particular bacteria. You have to retrospectively open this list and cross check. Got it? So but you have to learn it. Make a 5-star over this list and make it very important. Mark it very important. Got it? So this is selective media. Now coming on the fourth one, we are done with enriched, enrichment, selective. And now I'm coming on indicator media. The fourth one is the indicator media. Let's start indicator media. The fourth one. Okay. What is indicator media? Naam mein uska matlab hai. The name itself depicts meaning. What do you mean by indicator? Listen. Again, I'm having a wish. Can you fulfill? Wait, listen it first. So this is my specimen. Okay, it contains bacteria. This is my specimen. And this is my culture media. Okay, this is my culture media. Now I'm doing the inoculation. This is my inoculation. Okay, once I do the inoculation, bacteria get the nutrition. It starts dividing. And after 24 to 48 hours, it will form colony. By the way, what is a colony? It is forming a colony. Colony is a collection of millions of bacteria. One colony contains millions of bacteria, so it is visible with naked eye. We don't need microscope to see a colony. We can see with the naked eye because we can't see one bacteria, but we can see a collection of millions of bacteria. So I can see the colony. Once I get the colony, I become sure the specimen contains the bacteria. Bacteria is present because it formed the colony. But my wish, I am very busy. I don't have 24 to 48 hours. I'm very busy. I want the moment I'm doing the inoculation, at that time only, I want to know whether bacteria is dividing or not. At that moment only, I want to know. So, ma'am, how it is possible at that moment? You have to wait for 24, 48 hours. Once the colony is formed, you will come to know. No, I do not want that. Do some jugaad, do some arrangement, do something. So, say, ma'am, we can do one thing. We can add a chemical over here before you do the inoculation. That chemical will change the color. Okay, so once you do the inoculation, as soon as the bacteria divide from 1 to 2, it will change its color. So the moment bacteria will divide, it will change the color, and that's why it is known as indicator media. It is indicating us that the bacteria is dividing. Okay, that is the indicator. It will change the color. It contains a chemical. Now the two examples, Wilson and Blair and Macleod. Wilson and Blair and Macleod are two examples. This is for Salmonella typhi, typhoid bacteria. And this is Corynebacterium diphtheri, the diphtheria bacteria. Okay, this one contains sulfide to sulfide. Okay, as soon as bacteria divide, please mind my word, sulfide changes to sulfide, which give black color. That is an indicator media. And here, as soon as bacteria divide, tellurite changes to tellurium. That is again giving the black color and indicating. Both are indicator media, but you have to learn the chemical. Here the chemical is sulfide to sulfide. Here the chemical is tellurium to tellurite to tellurium. And color is black. That is indicator media. Okay. The fifth is differential. What was differential stain? Who's attending the session from the beginning? What is differential stain? People, what is differential stain? It gives different color to different bacteria. Differential media is same. It gives different color colonies to different bacteria. Okay. The best example is McConkey. On McConkey, the lactose fermenter form pink colony and non-lactose fermenter form yellow colony. The best example is McConkey. Okay, different color to different bacteria. The next best example is TCBS. On TCBS, you can see, just a second, Vibrio parahemelicus form green colony and Vibrio cholerae is forming yellow colony. Again, two different bacteria give two different color. The next is XLD. On XLD, E. coli give yellow colony and Salmonella give red colony with black center. So these are the differential media. You will learn all these again when I will teach you the systemic microbiology. These all bacteria will come, but you will understand the classification over there. The last one is transport media. What do you mean by the term transport media? The name itself depicts its meaning. Okay, this is my patient. Suppose this is my patient. You can see this is my patient. Okay, and my patient is comatose or my patient is the infant. My patient is very elderly. My patient cannot come to the laboratory for giving the sample. I want the sample of my patient. Laboratory is far away. Patient cannot come due to any reason. Say, ma'am, nowadays home collections are very common. Why don't you send someone from your laboratory, some technician from your laboratory to collect the sample? The sample can be transported to the laboratory. I say it's a good idea. On some extra charges, we can always offer the home collection. So I offered home collection to my patient. Okay. So collection is done. Suppose collection is done. Okay. Collection is done. Now the specimen contains the bacteria. Okay. Now my technician is transporting it to my laboratory. And during the transport, nearly 4 to 5 hours are required. Okay, laboratory is far away. Maybe the patient is in some periphery. 4 to 5 hours are required. Okay, most of the bacteria are comfortable. But there are some bacteria who are delicate darlings. You know, some people are delicate darlings. Oof, ouch. They are very delicate in nature. Okay, they are not hard and fast. So similarly, some bacteria are very delicate darling. So they cannot withstand hunger. Till they are in patient body, they are getting the nutrition. Once they are out in the test tube, they don't get the nutrition. So they cannot withstand without food. They cannot withstand hunger. for 5 hours. For 4 to 5 hours. They will die on the way. On the way, they will die. They will die. Once the specimen reaches the laboratory, I get zero growth. And I will give a false negative report to my patient that specimen do not contain any bacteria, but it's wrong. Specimen actually contain the bacteria. And it's a false negative report. Say, ma'am, what's the solution of this problem? So whenever I'm suspecting some delicate darling, in that case, I should not collect the specimen in a plain test tube. I should take a test tube which contain minimum nutrition. Minimum nutrition. Okay. And that is known as transport media. We can say snacks on the way. I'm not offering a full thali on the way. On the transport, I'm asking some chatter putter snacks on the way, and that is transport media. So collect the specimen in transport media which contain minimum nutrition, okay, so that bacteria will not divide, but bacteria will not die at least. So we will get the live bacteria to the laboratory, and that is the meaning of the transport media. How many of you got it? This is the meaning of the transport media. Got it? Now, who are delicate darlings? Who are delicate darlings? Learn the 4 delicate organisms and learn their corresponding transport media. Got it? So Neisseria, Vibrio cholerae, Shigella salmonella, and Streptococcus pyogenes. Group A beta hemolytic Streptococcus. Got it? So Neisseria के लिए we have Ames media and Stewart media. Ames and Stewart. For Vibrio cholerae, Venkatramana Ramakrishnan, a South Indian scientist. We have VR classification also in Vibrio. So Vibrio cholerae में Venkatramana Ramakrishnan, and we have CB also, Carey Blair. For Shigella salmonella, we have buffered glycerol saline and again Carey Blair. And for Streptococcus pyogenes, we have Pikes media. People, we will revise it again in the next 6 sessions. Don't worry. The complete general will be revised. When in systemic, the corresponding bacteria will come. When Neisseria will come, we will revise this. When this will come, we will revise this. So we are going to revise it again. Don't worry. Here on the fast track, you just see it. So I told you 6 types of special media. 6 types of special media I taught you. Okay, but this is for aerobic bacteria. Aerobic bacteria will grow on them. The 6 special media. What about the anaerobic media? Anaerobic bacteria. Name the anaerobic bacteria. Obligate anaerobe. Can't breathe air. Clostridium, bacteroids, actinomycetes. Are you able to grow these on these media? See, ma'am, they all are open. They all are open. Open means air is everywhere. There is no vacuum in the world. We have air everywhere. Can I grow these bacteria in any of them? See, ma'am, these all are open. You can't grow them. Okay, you need a special media for anaerobic bacteria. And that's why we created Robertson cooked meat media. It is known as RCM or CMB. RCM, Robertson cooked meat media. So what is Robertson cooked meat media? How we created for anaerobic bacteria? How we created? Take a test tube. Okay, first you take a test tube, first of all. Okay, now fill it with nutrient growth. The basal agar, the basal media, I mean. Fill it with nutrient growth. Now, you take a ox. It's an animal. You kill it. You kill it. You take the heart out. Okay, you cut the heart into small pieces. And you put some pieces over here. Okay, these are ox ke heart pieces. Ox heart pieces. I'm sounding very brutal, but this is the mechanism. Okay, this is how you have to create it. Now, what you have to do, the next, you have to take paraffin wax. Okay, mome, wax, paraffin wax, sterile. And you have to close the mouth of the test tube. Close the mouth of the test tube with the paraffin wax. So that, with the paraffin wax, so that no new oxygen can enter. No new. Seal it completely. Close it completely. Seal the mouth. No new oxygen can enter now. Okay, you will say, ma'am, I agree. No new oxygen will enter. But what about the oxygen already present in this space? There is no vacuum, you told us, no? What about the oxygen already present in this space? No worries. That's why we have taken ox heart meat piece. Now heat it on Bunsen flame. Heat it on Bunsen flame. Once you heat it on Bunsen flame, the ox heart pieces contain reducing agent. Okay, that will utilize the oxygen present in this space, and there will be zero oxygen over here. The new oxygen cannot enter, and the oxygen present in this space is utilized. And now it's an anaerobic medium. Okay, and you can grow the obligate anaerobes over there. You have to inoculate by injection. You don't have to open it. Once you open it for inoculation, again air will enter. So take an injection. And, okay, fill the specimen in an injection, and with the needle, with a thin needle, you just inoculate drop by drop. This is how the Robertson cooked meat media is made. Appreciate the image. Appreciate the image. Appreciate in this image, you can see this is the test tube. This is the nutrient growth. This is the ox heart meat pieces. And this is the paraffin wax. Okay, this is RCM. See the composition. So we are done. I guess we are done with the culture media. Everyone give me a thumbs up. Any doubt, people? Otherwise, I will ask the question. You ask the question, otherwise I will ask. Do you have any doubt? Can you answer my questions in that case? Please do so. Okay. So you can see the questions in front of you. Read the first question, tell me the answer. Loeffler media is an example of. Your options are indicator, enrichment, selective, or enriched. What is the correct answer? Let me see who is first. What's the correct answer? Please, everyone. What is the correct answer, people? Fast. Yes. Shreya is first to answer and correct, I guess. Yes. So the correct answer is Loeffler. Loeffler media is a media which contains serum. Any media which contains blood, egg, or serum is enriched media. So it will come in an example of enriched media. Okay, if I change it to blood agar, answer is same. Chocolate agar, answer is same. So these all are your PYQs. Okay. Which enrichment media is for Vibrio cholerae? Is for Vibrio. Okay, use your common sense. What is enrichment? Enrichment is liquid. Okay, I told you it's liquid which contains stimulatory or inhibitory substance. Yes or no? So it is broth. But unfortunately, all the options are broth. All the options are broth. Now you have to tell me specifically. Yes, so for Vibrio, yes, you all are right. So the correct answer is alkaline tachyon water. Okay, if I change the question to Shigella, answer is salinity broth. If I change the question to Salmonella, answer is tetrathionate broth. I hope you got it. I told you this thing. Okay, the next question, I guess, easy one. No, I guess nothing there to ask. Robertson Cook media is an example of. Enriched ki, enrichment ki, nutrient ki, anaerobic. I guess everyone knows. It's a simple question. Na? Anaerobic media. Robertson Cook media is an anaerobic media. I guess everyone knows. Okay, so we completed successfully this chapter also, the 6th chapter of General Microbiology. Quickly, yes or no? Okay, can we move to the next chapter? Show me some energy, people. If you show me some energy, my energy will touch the sky. But I want retrospectively the same energy at your end in the comment box. So give me a thumbs up, everyone. Can we start the 7th chapter? Can we start the 7th chapter in General Microbiology? Yes, of course we do. Okay, you are learning, you are understanding everything quickly. Yes, okay, great. So the next chapter is pathogenicity, microbial pathogenicity, bacterial pathogenicity, in which the most important virulent factor or pathogenic factor I will teach you is bacterial toxin. So coming on the next topic, bacterial toxins. There are 2 types of bacterial toxins. What are the 2 types of bacterial toxin? Exotoxin, endotoxin. I guess everyone know the 2 types of bacterial toxin. What are the 2 types of bacterial toxin? One is exotoxin, one is endotoxin. You get many true-false questions on that, and most of the students are always confused. I will tell you in the form of a story. Listen. Why exo is known as exo? See, this is the bacteria, this is the bacteria. Learn first general rule. Exotoxin is formed by gram-positive bacteria. Endotoxin is formed by gram-negative bacteria with few exceptions. But this is general rule. Exotoxin, gram-positive. Endotoxin, gram-negative. First you learn the general rule. Okay. Here the toxin is synthesized inside the cytoplasm of the bacteria. See. Toxin is synthesized inside the cytoplasm of the bacteria and it is secreted out. It is secreted out afterwards. Since it is secreted out, that's why it is known as exo. Exo mane out, bahar. Okay, it is synthesized inside the bacteria and then secreted out. Got it? Yes or no? See here. And it is a living bacteria, live bacteria. It is synthesizing and secreting out. See endotoxin. It is not synthesized in the cytoplasm. No way. No, it is not synthesized on the cytoplasm. It is not synthesized. Okay. It is a component of the cell wall. Have I taught you the cell wall? Who is attending the session from the beginning? Tell me cell wall of gram-negative bacteria. Gram-negative bacteria. What was the cell wall? Cell wall was not simple. Cell wall was having 5 components. Here we were having 2 components. Here we were having 5 components. One is plasma membrane, outer membrane, the space between the 2 periplasmic space, peptidoglycan, lipoprotein. The last one is lipopolysaccharide. I told you, lipopolysaccharide. So that is there. This is lipopolysaccharide. LPS. Lipopolysaccharide. So it's a component of cell wall. It is not synthesized. It's a component of cell wall. So whenever the bacteria are dead, this bacteria is dead, the bacteria rupture. The bacteria lysis. The bacteria lysis or rupture. Then it came out. So it is coming out of a dead bacteria, not a live bacteria. So this one is synthesized. This is the component of cell wall. This one is synthesized. This is not synthesized. It's a component of cell wall. Okay. This one is secreted out, but this one come at the time of lysis. It is not secreted out. It will come at the time of rupture. This one is a living bacteria. But this one is a dead bacteria. This one is a dead bacteria. This one was living bacteria. This one is a dead bacteria. Okay. Now, the next thing, please mind it. Okay. Now there are 4 things which are more in exo. The exotoxin are more potent, the endo are less potent. The exo are more specific, endo are less specific. Exo are more enzymatic, endo are less enzymatic. And exo are more potent, specific, antigenic. They are more antigenic in nature. They form more antibodies in human. Once they enter, they form less antibody. They are less antigenic. So these four properties, potency, specificity, enzymicity, and antigenicity, they are more in exo and less in endo. First you have to learn that. More in exo, less in endo. But, people, listen, I agree. The exo is more potent, more specific, more enzymatic, more antigenic. Okay, but once you heat it, it's heat labile. Okay, it gets destroyed. It's heat labile. I agree. The endo one is less potent, less specific, less enzymatic, okay, and less antigenic, but it's heat stable. You heat it, it survives. It's heat stable. So learn like that. 4 things are good, but 1 is bad. 4 things are bad, but 1 is good. This is how you can learn the easiest way. The last thing, people, wait. The last thing. Tell me their composition. Who will tell me their composition? Tell me their composition. This I already told you. This one is lipopolysaccharide, LPS. You know there are 3 macromolecules: lipid, carbohydrate, and protein. So this one contains lipid and carbohydrate. Lipopolysaccharide. Polysaccharide means carbohydrate. This one is protein. It's polypeptide. If you can learn like this. This is LPS. This is PP. Okay. So this is how you have to learn. You have to learn all this. Please learn. Okay. Now it will be very easy. Can we revise it quickly? This is gram positive. This is gram negative. Okay. This one is polypeptide. This is lipopolysaccharide. This is living bacteria. This is dead bacteria. This is secreted out. This is component of cell wall. This is more antigenic, more specific, more potent, and more enzymatic. This is less. But this one is heat labile. This one is heat stable. If I show you in the form of the table, it will be boring and you forget it. But now you will never forget and you can do all true, false, right. Yes or no? So please do learn this, this in the form of this diagram. Okay, so bacterial toxins is done. Okay, coming on the next chapter, bacterial genetics. Can we start bacterial genetics? Yes, we should. So let's start bacterial genetics. The next chapter, ultra important. Let's start bacterial genetics. Okay, so let's start it. Bacterial genetics. Okay, humans. How many chromosomes humans have? You know how many chromosomes human cells have? Yes, humans have 46 chromosomes. Rather than saying 46 chromosomes, you can say 23 pairs of chromosomes. Yes or no? Pair number 1, pair number 2, pair number 3, pair number 4, pair number 5, likewise. So total 23 pairs are there. Human cell. Okay, nucleus have 23 pairs of chromosomes. Bacteria have how many chromosomes? Bacteria don't have a nuclear membrane. Bacteria don't have a well-formed nucleus. How many chromosomes are there? 1 single, and that too circular. 1 single chromosome, that too circular. So here we have 23 pairs. Here we have 1 single chromosome, and that too circular. Okay, first you understand that. So same thing is written in front of you. You can appreciate. Okay, same thing is written. It's a circular single chromosome. It contains 1 single circular chromosome that is made up of dsDNA, double-stranded DNA. You can see this is bacterial chromosome. Now, can you tell me extra chromosomal genetic material? Let me tell you what does I mean. This is a bacterial cell. Okay, this is the nucleus of the bacteria containing a chromosome. Bacteria don't have well-formed nucleus, but this is the chromosome of the bacteria. Okay, single circular chromosome. Okay, it is chromosome made up of DNA. Now my question to you, does DNA, okay, this is DNA, this is double-stranded DNA. My question to all of you, does double-stranded DNA, that is genetic material, present anywhere else apart from chromosome? Does genetic material present anywhere else apart from chromosome? That is known as extra chromosomal material. Yes, it is present. It is present at 2 places. What are the 2 places where it is present? It can be present in the cytoplasm. Once it is present in the cytoplasm, it is known as plasmid. What it is known as? Plasmid. It is also made up of dsDNA, but it is not chromosome. It carries genes, but it is not chromosome. They can be transferred, but it is not a chromosome. Okay. Once this plasmid come and merge with the nucleus, it integrate with the nucleus. The same plasmid is known as episome. What it is known as? It is known as episome. The same plasmid is known as episome. You are getting it? Yes. The same plasmid is known as episome. So episome and plasmid is same. This is present in cytoplasm. This is present in nucleus. Once it is merging with the nucleus, it is not a part of chromosome. It is still separate. It is not chromosome. It is extra chromosomal. Okay. So please learn what is the concept of plasmid and what is episome. Plasmid in cytoplasm, episome integrate with the chromosome in the nucleus. So that is extra chromosomal genetic material. You can appreciate this is chromosome, okay, double stranded DNA. Appreciate these are plasmids. They will go and merge here. Once they will go and merge here, they are known as episomes. Appreciate their episomes. You get image based question or short question over there. Okay, now the most important thing here I would like to tell you is gene transfer. Can gene be transferred between two bacteria? Yes. Genes can be transferred between two bacteria. There are 4 mechanisms via which the genes can be transferred between bacteria. What are the 4 mechanisms? Transformation, transduction, lysogenic conversion, and conjugation. These are the 4 mechanisms via which the genes can be transferred between the bacteria. One by one, we'll deal with that. The first is transformation. What is transformation? See the 2 bacteria. Suppose this is bacteria A, this is bacteria B. They have the chromosome. Although chromosomes are circular, but for the sake of understanding, easy understanding, I have drawn them linear. But they are circular. Okay, I have given different color. Bacteria A have red chromosome. Bacteria B have blue chromosome. Okay, now imagine the first bacteria is dead. Yes, you heard me correct. The first bacteria is dead. Imagine the first bacteria is dead. Suppose. So once the first bacteria is dead, what will happen? The chromosome will leak out. This will leak out, and by leaking out, it will go paddle, okay, walking by itself. It is known as free DNA. Free DNA or naked DNA. Free or naked DNA. This free or naked DNA will go without any agency, without any transporter, without any vehicle. खुद से अपने पैरों से walking and enter the second bacteria. Once it enters the second bacteria, it have 2 choices. Either it will make a plasmid or it will make an episome. It will integrate. Okay, whatever it is. This mechanism is known as transformation. Transformation. There is no vehicle, mind my words, no vehicle is required here. It is free DNA. It is free DNA, naked DNA, which is moving from the dead bacteria, leaking from the dead bacteria and entering inside the living bacteria. So this is known as transformation. So the word here to be picked up here is free or naked DNA, no vehicle, no agency. Okay, so there is an experiment to prove that. The experiment is Griffith experiment. I guess everyone knows about the Griffith experiment, the 4 mice experiment in which Streptococcus pneumoniae is injected in the mice. I'm not repeating this experiment here. That I will teach you in Streptococcus pneumoniae. Okay, now the second mechanism is transduction. Transduction. What will happen here? Again, we have 2 bacteria, A, B. I want to transfer the genetic material of A into B, but I need a vehicle. Here we have a vehicle. We have a transporter. Okay, we have a transporter vehicle, a car. There is a car. So the vehicle here is bacteriophage. The transporter here is bacteriophage. By the way, what is the bacteriophage? Bacteriophage is a virus which affect bacteria. Virus किसी को नहीं छोड़ते. Virus infect human. Virus infect bacteria also. The virus which infect the bacteria are bacteriophage. Okay, so this is the virus which entered the first bacterium, infecting the first bacteria. Okay, while infecting, when it is replicating, okay, it will stole, चुरा लेगा, stole a portion of DNA of this bacteria. चुरा के आ जाएगा, it will stole a portion of DNA and come out, and it will come out. Okay, after coming out, the same bacteriophage enter the second bacteria. Whatever stolen from there is given to this. It is given to this. It is given to this bacteria. So who's the agency who's transferring? It is virus, bacteriophage. Entering the first bacteria, stealing a part. It is known as packaging error. What is known as packaging error? After that, it comes out and enters the second bacteria. Do you have Swiggy in your city? Zomato in your city? Do you have Zomato people? Porter, I guess Swiggy, everyone, all the cities have it, I guess. I don't know. Okay, what do these people do? They do pick and drop. So it is like, you can compare. The transduction is like this. It is Zomato, it is Swiggy, it is pick and drop. So the virus is picking from here and dropping it here. Okay, picking the nucleic acid, dropping it here. Picking the genetic material, dropping it here. Pick and drop service. Apna kuch lena dena nahi. So pick and drop service, that is known as transduction. So the other name of transduction is pick and drop. Pick and drop. You can learn Swiggy and Zomato. Okay, so here we have a bacteriophage who is doing this transfer. You can see this image, it's same. Got it? That is the second way. The third way, now you please appreciate the third and you tell me the difference between second and third. This is lysogenic conversion. The third one is lysogenic conversion. Let me tell you what is lysogenic conversion. Rather, you tell me what is the difference. Here also, people, we have bacteriophage. But here we have only one bacteria. We have only one bacteria. We don't have other. Okay, only bacteria A. We don't have bacteria B. Bacteriophage, which is a virus. It will enter the first bacteria and donates its own nucleic acid, the green color. its own nucleic acid to the bacteria. So it's a transfer between a bacteria and a virus. Okay, you will say, we in transduction also we have a bacteriophage. In lysogenic conversion also we have a bacteriophage. What's the difference? What is the difference? You tell me the difference. Here bacteriophage is acting as an agency. It's an agency or transporter. It is just picking and dropping. Its own nucleic acid, the green color nucleic acid is not involved. It is pick and drop, Swiggy, Zomato. But here in lysogenic conversion, the bacteriophage is giving its own, only dropping. Its own nucleic acid. Okay, so it's a transfer. This one is a transfer between two bacteria via virus. And this one is a transfer between one bacteria, one virus. You get question on that. People, you get question on that. Mind the difference. The best example over here is diphtheria. Corynebacterium diphtheria. You know, there are two types of Corynebacterium diphtheria. Corynebacterium diphtheria is a bacteria. There are two types of Corynebacterium diphtheria. This is a Corynebacterium diphtheria. This is a Corynebacterium diphtheria. Both of them have chromosome. This is the chromosome. Okay. Now the first one is having tox gene. So it can form toxin. And this one is known as toxigenic strain. It can cause diphtheria. It's pathogenic. The second one have no tox gene. So it cannot form the toxin. And this is non-pathogenic, non-toxigenic. If this one entered to me, I will have diphtheria. If this one entered to me, I will not have diphtheria. I hope you got it. Okay, so there are two types of Corynebacterium diphtheria. I guess everyone knows. Now, I am having a wish. First, you listen my wish. Can you fulfill it? I want to convert non-toxigenic to toxigenic. Can you do it for me? Use common sense. Can you do it for me? Say, ma'am, if it get tox gene from somewhere, it will get converted. But who will give the tox gene? Who will give the tox gene? So we will arrange a bacteriophage. A bacteriophage will come. Okay, I will call it beta phage. It's a beta phage. It is having the tox gene, its own tox gene. It is having a tox gene. It will enter and it will donate this tox gene to this bacteria. And it will convert from non-toxigenic to toxigenic. So if you want to convert a non-toxigenic diphtheria to toxigenic diphtheria, it is via lysogenic conversion. That is the best example over here. You can see the diagram. I hope you got it. Okay. The fourth and the last type of gene transfer. Till now I taught you three. I taught you transformation, transduction, lysogenic conversion. I hope you know all three. Yes or no? These three are done. Now the last one is conjugation. The last one is conjugation. Yes or no? The last one is conjugation. Say yes. So what is conjugation? Conjugation is sexduction. The sex in the bacteria. The sexduction in the bacteria. Okay. So here in the last three, bacteria were not coming physically closer. Neither in transduction, nor in transformation, nor in lysogenic conversion. They were not coming and touching each other. Here the two bacteria come physically closer. They come physically. This is the bacteria, they are coming physically closer. And they are forming a tube between them. With the help of fimbriae, I told you what is fimbriae, the organ of adhesion, the organ of conjugation. So with the help of fimbriae or pili, they are making a tube. And via this tube, the genetic material is transferred from one bacteria to another. So it is known as sexduction in bacteria, or it is known as physical mating or physical contact in the bacteria. That is conjugation. Conjugation is of two types. You can see the diagram. You can see bacteria A, bacteria B coming physically closer, making a tube, and the genetic material is transferred from one bacteria to another. Got it? Huh? This is conjugation. Conjugation is of two types. Let me tell you the two types of conjugation. What are the two types of conjugation? F factor and R factor. F factor also known as F plasmid. Okay, and the second one is R factor. F factor, R factor. These are the two types. F factor also known as sex factor or fertility factor. Okay. What is F factor? In bacteria also we have male and female. The genders. Yes, they do have. Listen, see the two bacteria. What is the difference between them? Both of them have chromosome. Single circular chromosome, single circular chromosome. What is the difference between them? The first bacteria have F plasmid. So I will call it a male bacteria. Okay, the second do not have this plasmid. I will call it female. I will call this one as female bacteria. I cannot write it here. Female bacteria. Got it? They are coming physically closer. They are making a tube between them. They are performing sexduction. Okay, now once they start, one is male, one is female. The male will duplicate the F plasmid. This is known as F plasmid. Here F plasmid present, F plasmid absent. This is F positive, this is F negative. This is male, this is female. Now the F plasmid will get duplicated. One copy is kept here and the other copy is transferred to the second bacteria. Okay, now both have F plasmid. So both become F positive. In other words, both become male. So mind my words, people. When they started, let me see if I can't use the highlighter. Anyways, when they started, one is male, one is female before sex. And after sexduction in bacteria, both become male. So one was F positive, one is F negative. F positive, F negative when they started. But when they end, both become F positive. Both become male. It is known as transfer of maleness. What it is known as? Transfer of maleness. It happens in bacteria. So this is the relevance of the F plasmid. The donors are F positive. They are male. And the recipients are F negative. They are female. When they start, one is F positive, one is F negative. When they end, both become F positive. It is transfer of maleness. I hope you got it. The second is the R factor. There are two examples. No? There are two examples of conjugation. We have seen F factor. It is sex factor. It is transfer of maleness. The second is R factor. R for resistance. F for fertility. R for resistance. Okay. What do you mean by resistance? R factor. See the two factor here. A, B. They are best friend. Best friends. Janmo ke friends. They are best friends since childhood. Suppose. Okay. What is the difference between them? Say, ma'am, this also have a chromosome. Single circular. This also have a chromosome, single circular. What is the difference? What is the difference? This one is having R plasmid. This one don't have R plasmid. So this one is R positive, okay? And this one is R negative. Getting it? This one is having R plasmid. This one don't have R plasmid. See, ma'am, what is R plasmid? R plasmid means resistance. Okay. What are these letters? T for tetracycline. This is sulfonyl urea. This is cephalosporin. Okay. This is another antibiotic. These are various antibiotics. So when tetracycline will come, cephalosporin will come, tetracycline, cephalosporin, sulfonyl urea, any of them will come. This will not die. I want to kill this bacteria. Okay, this is present in my patient body. So I'm giving these antibiotic to my patient, but this is not killing because it is having the resistance. So it is good for bacteria, but not good for me, for doctor and for patients. Okay, it is having the resistance. But if I give the same antibiotic to this bacteria, it don't have R plasmid, it will get killed. Okay. Now these two bacteria are friends, now. So this one is saying to this. Bacteria B is saying to bacteria A. We are best friends now. So when tetra will come, cephalosporin will come, sulfonyl urea, you will survive. I will die. Huh? You like this thing? I will die. I'm your best friend. I will die. So why don't you give this plasmid to me also? I will also get resistance. So this bacteria say, okay, let's come together. Let's come closer. Let's do conjugation. So the two bacteria come closer. Okay, the two friend bacteria coming closer. They are making a conjugation tube between them. This bacteria is replicating the plasmid. One copy is kept by himself and one is given to the partner, sexual partner. So one copy is transferred to the sexual partner. Now at the end, this also have R plasmid. This also. Now when tetracycline, cephalosporin, sulfonyl urea will come, no one will die. So it is transfer of resistance. At the start, one is R positive, one is R negative. When they end, both become R positive. Appreciate this. It is transfer of resistance. So here the transfer of maleness occur and here transfer of resistance occur. That is the two type of conjugation. How many of you got it, people? So there are 4 ways of gene transfer. There are 4 ways of gene transfer. Give me a thumbs up if you got it, everyone. What are the 4 ways of gene transfer? Can you say it quickly? What are the 4 ways of gene transfer? Transformation, transduction, lysogenic conversion, and conjugation. Can you revise it? In transformation, there are 2 bacteria. The first one is dead. Once the first one is dead, okay, the DNA leak out. And after leaking, it enters the second. Okay, so it is free DNA or naked DNA. No agency is required. In the second one, there is an agency. The name of the agency is bacteriophage, also known as virus. Okay, first it enters the first bacteria, stole a portion, whatever stolen, given to the second. Pick and drop, Swiggy, Zomato, Porter, all the services. Pick and drop service. So that is bacteriophage. Transfer between 2 bacteria. Bacteria 1, bacteria 2. Okay. Here also in lysogenic conversion, we have a bacteriophage. We have a virus. But it enters the first bacteria and gives its own DNA to the bacteria. So it's a transfer between a bacteria and a virus. We don't have second bacteria over here. And the last one is conjugation, sexduction, physical mating, physical contact between the 2 bacteria, in which 2 bacteria come physically closer. They make a tube, and via this tube, there is transfer of the genetic material between the 2 bacteria. And it is of 2 types, transfer of maleness and transfer of resistance. We have F plasmid ka transfer and we have R plasmid ka transfer. Everyone got it? Anyone have any confusion? Say something, respond. Give me a thumbs up, people. Come on, everyone. Show some energy. Huh? Are you tired? I am not. Are you? Huh? Chalo, we will finish it quickly. The complete general microbiology. Quickly we have to finish. So coming on the next thing. The next thing is blotting technique. Can I start the next one? Chalo, everyone. We will start the next one. Everyone. Chalo. Next is the blotting technique. There are 4 types of blotting. I will tell you all 4. What do you mean by blotting technique? Okay, don't go in the details of the step. Nobody is going to ask you that. Understand the relevance. Why we do blotting? Now, how many organisms are there? So please understand why we perform blotting technique. Why we perform. I told you there are 150 organisms. By the way, I'm teaching you all 150 organisms from tomorrow onwards in the next 6 sessions. Yes or no? So 150 organisms, some of them are bacteria, some virus, some parasites, some fungus. Suppose this is my patient. Okay, suppose this is my patient and my patient is having certain infection. Okay, in the blood. Okay, this is the microorganism present in the blood vessel of my patient. This is the microorganism. I don't know whether it's a bacteria, virus, fungus, or parasite, but my patient is having infection. I'm a doctor. I want to treat my patient. Okay, so I want to know whether it's a bacteria, virus, fungus, or parasite. The most important thing and interesting thing is that all the 150 organisms, medically important organisms, they have unique gene or unique DNA in them. You remember, it's a very good thing. So based on the symptoms and signs of the patient, out of 150, what is your differential diagnosis? You're going to test all 150. So you ask the detailed history, you see the symptoms, you ask the symptom, you examine the signs in the patient. Based on them, out of 150, you will have 4 to 5 or some differentials. So maybe it is this, maybe it is TB, maybe it is AIDS, maybe it is this. You may have some differential in your minds. You cannot test all 150, of course. Okay. The broader is your knowledge, the narrower will be your differential diagnosis, obviously. Okay. So you will have some differential diagnosis. Now you want to become sure of one of them. One of them should be the answer and you want to give specific treatment to your patient. So test the specific unique DNA of that 4-5. Now you can test those 4-5. So whatever is your suspicion, you can test those. One of them should be correct if your suspicion is correct. Yes or no? Huh? So yes, it's a good idea. So I will test the DNA. This is double-stranded DNA. I will test the DNA. Later on, we find out if there is unique DNA, there may be unique RNA. DNA से RNA बनता है. Or RNA से protein. If there is unique RNA, there is unique protein also. So we can test unique DNA as well as unique RNA as well as unique protein. See, this is the bacteria present in my patient blood. As I have drawn now, this is the blood vessel of my patient. Imagine, this is the blood vessel of my patient. In the blood vessel of my patient, this organism is present. It can be bacteria, virus, fungus, or parasite. I don't know. Okay, you can see this is the nucleus. Okay, the red one is the DNA, the blue one is the RNA, and the green one is the protein forming on the ribosome. Now I want to know which organism is it. Okay, so this is unique DNA, this is unique RNA, and this is unique protein. Now it's my choice. I can test unique DNA, I can check unique RNA, I can check unique protein. If I'm checking unique DNA, it is known as southern blot. Okay, southern blot. If I'm checking unique RNA, it is known as northern blot. And if I'm checking unique protein, it is known as western blot. How many of you got it? So there are 3 blot. There are 3 blot. So how to learn? How to learn that DNA is southern, RNA is northern, and protein is western? How to know that? Say, how to know that? I'm having an easy mnemonic to learn. The mnemonic is snowdrop. Write the spelling like this. Okay, omit O. Omit O both the places. Here also omit O, here also omit O. Okay, now southern is for DNA, D for DNA. Okay, southern is for DNA. Northern is for RNA. You can see the northern is for RNA, R for RNA. Okay, and western is for protein, P for protein. Western is for protein. This is how you can learn. The mnemonic is snowdrop. How many of you got it? Huh? So this is snowdrop. So you get questions. Southern blot, DNA. Northern blot, RNA, and western blot, protein. Western blot, protein. Now there is the eastern blot also. Nowadays we call it eastern blot. Say, ma'am, what is eastern blot? In which we are not testing DNA, we are not testing RNA, we are not testing protein. This is present in the blood of the patient. Now my patient will form antibodies against it. Okay, these are the antibodies present in the blood vessel. This is the blood vessel. In the blood vessel, my patient is forming antibodies. If I am testing the antibodies, it is known as eastern blot. If I am testing the antibodies, it is known as eastern blot. So you can learn eastern blot also, in which we test the antibodies. Huh? Got it? Any confusion? Some questions. Read the question, tell me the answer fast. Let me see who is the first. Let me see who is the first. Come on, fast. DNA is detected by. Write down, na? Snowdrop. S-N-O-W-D-R-O-P. Omit O. Omit O. So DNA is detected by southern blot. Everyone is right. Everyone. If I change the question from DNA to RNA, answer will become northern. If I change it to protein, answer will become western. If I change it to antibody, answer become eastern. Okay, this is how you have to learn it. Okay, now the next question in front of you. Read the question, tell me the answer. Movement of DNA from one bacteria to another via conjugation tube or via pilus, via fimbriae. What is it known as? What is it known as? Yes, everyone is right. Okay, you people are too fast. Very good. So correct answer is conjugation. If I change this question, suppose if I'm changing via connecting tube ki jagah, if I'm calling it via, I'm unable to repeat it. Bacteriophage, suppose via bacteriophage, then what will be your answer? In that case, your answer becomes transduction if it is via bacteriophage. Okay, got it? Now, I guess the last topic in general bacteriology is antimicrobial susceptibility test. After that, I will come on general virology. Okay, the next topic here is general antimicrobial susceptibility test. Okay, I guess this is the 8th chapter or 9th chapter we are taking in general bacteriology. So let's start antimicrobial susceptibility test quickly. Can we start? Okay, let's start it. Antimicrobial, please text your query on my WhatsApp number. I have given my WhatsApp number. Here it is difficult to attend all the queries. I can see some queries. I'm tempted to answer them, but it will take time and it will leave the syllabus. Okay, so please do. I request you to ask your queries on my WhatsApp number. Whenever I will be free, I will leave a voice note on that. Okay, chalo, come back. So here, the next topic here, antimicrobial susceptibility test known as AST. What is AST? See, everyone here, everyone, we all are doctors, right? Of course we are. This is my patient. Can you see my patient? Yes. This is the organism present in my patient. Now it can be, suppose it is a bacteria only. We are talking about bacteria. It is one of the bacteria who is causing infection in my patient. Now this patient is coming to me. I am a doctor. We all are doctors. So here we are. We all are doctors. What is my moral? What is my ethics? What I want to do? I want to treat my patient. For treating my patient, I will give the antibiotic. Now I am having a cocktail of antibiotic with me. I am having a cocktail of antibiotics with me. Which should I give? I want to give the specific drug which hit this organism. I cannot hit and try. First try this. If it is not working, then let's try this. If it is not working, let's try. I cannot make my patient to suffer for more days. I want to give bullseye. Okay, the pinpoint antibiotic which hit this microorganism and kill this microorganism. Say, ma'am, how would you know that which antibiotic is working for your microorganism? You have a cocktail with you. I will apply antibiotic susceptibility test. So I will apply the AST, antibiotic susceptibility test for this microorganism, and I will see this particular microorganism present in my particular patient is susceptible for which cocktail of antibiotic. Among the cocktail of antibiotic, it is susceptible for which one? Maximum susceptibility is for which one? I will directly give with that antibiotic if it is not contraindicated. That is the use of antimicrobial susceptibility test. First you understand the importance, then you will understand the mechanism and types and everything. Yes or no? First you understand the importance. So there are 4 types of antimicrobial susceptibility test. What are the 4 types of antimicrobial susceptibility test? They are in front of you. The first is diffusion method, also known as Kirby-Bauer diffusion method. Okay, this is most commonly used. Most commonly, I will explain. Okay, second is dilution method, also known as growth dilution method. The third is epsilometer, known as E-test. Frequently asked question in INICT 2 times. E-test. And last one is automated. It is known as Y-tech method. I will explain all 4. Okay, the first one is most commonly used. It is known as diffusion method. It is most common. It's the PYQ. Also known as Kirby-Bauer. So basically, what is the principle here? Okay, we take first understand the principle, the basic. First understand that. Listen, we are taking a Muller-Hilton agar. What we are taking? Muller-Hilton agar. We are taking a Muller-Hilton agar, the agar plate. Basal agar plate, Muller-Hilton agar plate. Okay, what we are doing? We are taking a filter paper, suppose, and cutting it in a circular fashion. Suppose this is a filter paper. I have cut it in a circular fashion. Okay, imagine it's circular. It's not circle, but imagine if it is a circular filter paper, and I'm keeping it at the center of the agar plate. Okay, it is the form of a disc. Okay, no. Take a filter paper, cut it in a circular fashion, dip it in the particular antibiotic you want to test. You want to test penicillin? Dip in penicillin. You want to test cephalosporin? Dip it in cephalosporin. Which penicillin, which cephalosporin? You want to, whatever antibiotic specific, you want to test it for azithromycin? Dip it in that. So whatever antibiotic you want to test it, you dip the disc, okay, that is filter paper in that, and keep it at the center of the agar plate. Keep it at the center of the agar plate. So can you see this red color? These red color are the filter paper which contain antibiotic in them. Particular antibiotic of particular strength. The strength is decided. Particular antibiotic. The antibiotic is based on your differentials. Whatever your differentials are, that organisms are susceptible to whatever antibiotics, we will choose those. Okay, so this is the antibiotic disc we are keeping, and this is the sample of my patient. The sample can be blood, can be urine. Okay, this is the sample. Inside the sample of my patient, this microorganism is there. See, so this is a sample of my patient. I'm pouring the sample here. I'm pouring the sample here and doing a lawn culture. I'm doing a lawn culture. I'm doing a lawn culture. The yellow color is the colony. After 24 to 48 hours, I will get the colony. The yellow color is the colony. Now see the pattern. See the pattern. Here the colonies are at the periphery. Appreciate the colonies. They are at the periphery. They are not moving closer to the antibiotic. No, because they are afraid. Okay, once they will move it, antibiotic will kill them. So this is known as susceptible. Okay, this organism is known as susceptible to this antibiotic. That's why it is not, the colony is not growing closer. It is growing at the periphery. Okay, so you can clearly see a zone which don't contain any colony. This zone is known as zone of inhibition, ZOI. What is it known as? ZOI, zone of inhibition. You have to measure it with a vernier caliper. Have you seen vernier caliper is a scale which measures the smaller distances. With the help of vernier caliper, I will show you. You have to measure this distance. So based on this, we will decide whether it is susceptible or resistant. See the second one. See the second one. Where is the colony? See, ma'am, colony is nidder. It's resistant. It's touching the rim of the antibiotic. It don't have any fear. Because antibiotic cannot kill it. It is not afraid. It is coming and touching the rim of the antibiotic. So this one is resistant. Here the zone of inhibition is almost absent or very minute. Here zone of inhibition is very wide. So basically it is ZOI who is going to decide. Okay, so on 1 Miller-Hulton agar, you can test multiple antibiotic. You can appreciate this diagram. So you can appreciate this is Miller-Hulton agar in which multiple antibiotic, different antibiotics. Suppose this is penicillin, this is azithromycin. This is one of the cephalosporin, this is tetracycline. Multiple antibiotics we can take, okay? And we are taking the filter paper, dipping in them and keeping it here, okay? And we are doing the lawn culture. And with the help of the vernier caliper, I will measure the ZOI. So here, the ZOI is very small. Here it is big. Here it is very big. Here it is moderate. Here it is almost zero, So based on the ZOI, zone of inhibition, I will decide whether the antibiotic is susceptible, resistant or intermediate based on the millimeter. How many millimeter is ZOI? I hope the concept is clear. I mean, I tried. I don't know whether you got it or not, but I tried from the depth of my heart. So this is the concept. Students don't even have, you people don't even have the concept. What is AST? This is the day-to-day routine we perform in our laboratories. This is AST, antibiotic susceptibility test. How many of you got it? Everyone got it? This is how we perform it. So this is the complete procedure written. The same thing I have told you. So you have to basically measure the ZOI. Okay, with the help of the vernier caliper. Okay, based on which we will decide whether the antibiotic is sensitive, intermediate or resistant. So WHO has given us a list. So which antibiotic at what millimeter? Okay, we say it is sensitive, it is intermediate, it is resistant. You don't have to learn that list. You have to just learn the concept. If ZOI is very small or almost nil, it's resistant. If ZOI is big, it is sensitive. This is the basic concept you have to learn. You don't have to learn this list at your level. The second method is dilution method. Dilution method. This diffusion is done. Now we are coming on the second method. The second method is dilution method. Okay, here we don't take Miller-Hulton agar. We don't take the filter paper. We take a series of test tube. Can you see the series of test tube? In all the test tube, I will put my specimen. This is my specimen of the patient, which contain bacteria. Of course, it contains bacteria. I'm putting 1 unit of my specimen in all of them. 1 unit. Okay, 1 unit. 1 unit, 1 unit, 1 unit, 1 unit, 1 unit, 1 unit, 1. In all of them, same concentration, I mean to say. Specimen ka same, bacteria ka same concentration. Specimen contain bacteria. So bacteria ka same concentration in all of them. Okay, now I will choose one of the antibiotic. Suppose my antibiotic is tetracycline. I want to test whether the bacteria present in this specimen is sensitive or resistant to tetracycline. So I will take tetracycline in different concentrations. Okay, in different concentration. It is known as serial dilution. I will keep on diluting. So here I will put the most concentrated form. Okay, see, here I am putting 64. Here I am doing the half. Okay, 32, 16, 8, 4, 2, 1. I'm halving the concentration. What I'm saying? I'm halving, half. 64 ka half. Here I'm putting 64 unit. Here I'm putting 32 unit. Okay, I'm diluting the antibiotic. Okay, so when the antibiotic is able to kill, now here I have put the bacteria. Bacteria show turbidity. So see, all these test tubes show the turbidity. Okay, the moment antibiotic kill the bacteria, the turbidity is disappear. So I can see turbidity here at lower concentration. I can see the turbidity, but here turbidity disappeared. I can't see the turbidity index. So this is the minimum test tube. This is the minimum concentration at which antibiotic is able to kill the bacteria. So this is known as MIC, minimum inhibitory concentration. This is the minimum inhibitory concentration, that is 8 unit, whatever antibiotic is that. At this unit, it is able to just kill the bacteria. I will set my dose this or a little bit higher than that. I will give this dose to my patient. This is known as MIC. So here we can't tell MIC. Okay, in this method, we just tell whether the bacteria is sensitive or resistant. Okay, but here we can tell whether the bacteria is sensitive. If the bacteria is resistant, all of them are turbid. None of them is clear. But here the clarity is there, means the bacteria is sensitive. Antibiotic is able to kill the bacteria. That's why it is cleared. Otherwise, they all should be turbid. So I'm sure it is sensitive. Okay, so we can able to say, is it sensitive or resistant? Not only this, we will be able to say the MIC also. So that is the advantage of this method. How many of you got it? How many of you got it? You are getting it? Yes, no, say something. Yes. So this is the dilution method, the second method. Here we are able to calculate minimum inhibitory concentration also. Let's mix the two methods. Okay, and the third method is epsilometer method or E method. The third method is epsilometer method, also known as E method. Epsilometer method or E method. What we will do, again it is like the first one only, this diffusion method. So basically we are taking a Muller-Hilton agar. Okay, now instead of taking the filter paper in small circular fashion, no, I'm not taking. I'm taking a big rectangle. Filter paper only, a big rectangle. Let me form it. Suppose it's a filter paper, a big rectangle. And here, if I was taking small circles, I was just dipping it in complete antibiotic. So it is containing one concentration of the antibiotic, but this one is graded. So here low concentration of antibiotic, here high, it is high, like that. So here it is known as E strip. Okay, epsilometer. It's a strip. You can appreciate the strip. Okay, it is dipped in tetracycline. They all are tetracycline, but in different concentration, 0.16, 0.20, 0.47 likewise. So it is graded. It is known as gradient. Okay, it is not completely one, it is gradient. And I am putting it at the center. Okay, I am pouring my specimen. And I am looking for zone of inhibition ZOI. Here ZOI is not a circle. The ZOI is elliptical shape. You know what is elliptical shape? Here ZOI will be in the form of elliptical shape. You know, you can appreciate the ZOI. Okay, and this is MIC. This point, the intersect is the MIC. I hope you can understand. Okay, so this is E method. Okay, epsilometer method, E for epsilometer. So it is a graded strip. So we can know MIC without taking test tubes. And the last one is automated. Nowadays, nobody performs that. Everything is automated. So we put our specimen, and there are small wells, okay, having antibiotic in different concentration. And we put one unit of specimen in all the wells. We put this plate inside the well, inside the instrument that take the reading every 15 minutes. Every 15 minutes that take the reading, and that will tell the MIC. As soon as the turbidity disappear, it will indicate. An indicator is there. So this is automated. So there are 4 methods to test antibiotic susceptibility in my specimen. This is the specimen of my patient, which contain bacteria. I want to know my bacteria, the patient specimen bacteria is susceptible to which antibiotic. So I can directly give that antibiotic and my patient can be treated. So I'm having 4 methods. Most important method, most common method is this diffusion method, Kirby-Bauer method. Second is dilution method. Okay, here we cannot calculate MIC, here we can calculate MIC. Let's combine the two, and third method is E method, in which the ZOI is elliptical, and here we can calculate MIC again. Okay, and nowadays we use automated one. Okay, I hope everyone got it, and this chapter is also done. Say, people say, we are done with the general bacteriology. I taught you all 9 chapters. People say yes, all the important portion. This was a rapid revision. Still my speed is less. From tomorrow onwards, I will increase the speed further. I will cover all 150 bugs, all bacteria, all virus, all fungus, all parasite in all system without skipping a single one. And that will be a real rapid revision. Don't you dare to miss tomorrow's session. Okay, tomorrow's session is again on YouTube. Okay, so can we start general virology? It will take another 40 minutes. We will complete it quickly. Yes, so kindly show some interest, people. Can we start? Yes, so let's start it. Okay, chal. Let's start quickly general virology. Virology is small, it's not big. So quickly general virology, it will take another 40 minutes, and after that we will pack the session. So let's start general virology. General parasitology, mycology, we have to learn just classification itself. In the general class, parasito and myco, there is nothing else apart from the classification. And that I will put the recording on the app. Okay, and from tomorrow on the YouTube, I will start CVS infection. bloodstream serious infection. I will teach you nearly 25 organisms tomorrow. Okay, I guess I will teach you 7 of bacteria, few virus, many, 10 fungus I will teach you. So I will teach you all bacteria, virus, fungus, parasite in CVS. But that tomorrow. You will understand the unique way of master chart, the magic of the master chart. But tomorrow. So before that, let's finish virology quickly. So you will have a better understanding tomorrow. Okay, before I start virology, you must understand the basic structure of a virus. How does a virus look like? Draw the basic structure of virus. There are 2 types of virus. Okay, all viruses have one thing in common. What's that? All viruses have one thing in common. What's that? Nucleic acid. Nucleic acid core. So we can see this is the nucleic acid core present in all viruses by default. But it is made up of either DNA or RNA. I'm using the word or, not and. It contains either DNA or RNA, never both. Never both, never both. Mind it. Okay, it is covered by a protein covering. The protein covering is known as capsid. The protein covering is known as capsid. Capsid, protein covering. It is a polymer made up of monomer. The monomer is the capsomer. The monomer, you can see this is the monomer. Multiple monomers are there. The monomers are the capsomer. So capsid is made up of capsomer. So nucleic acid present in both. Capsid present in both. But the third thing is not present in both. That will differentiate the 2 viruses. This one don't have envelope. This one have envelope. So some viruses are non-enveloped, some are enveloped. That is envelope. The non-enveloped viruses are known as naked virus. These are naked virus. And the viruses which have envelope are known as enveloped virus. So there are 2 types of virus based on envelope. Naked virus, enveloped virus. So now the basic structure of the virus. Okay, this is the basic structure of virus. You can appreciate it here. You can see nucleic acid. It is made up of DNA or RNA, never both. Capsid, it is protein and envelope. Some viruses have it, some do not have it. Appreciate. This is naked virus and appreciate. This one is envelope. Nucleic acid present in both. Capsid present in both. Okay, that is the thing. Now, tell me the classification of virus. We have seen the classification of bacteria. The most common classification of bacteria is gram stain. Based on gram stain, we classify the bacteria into 4 categories. Okay, GPC, GNC, GPB and GMB. Yes or no? Based on the gram stain. So let's classify virus. Let's classify virus. We classify virus based on nucleic acid. Okay, here's the classification based on gram staining. Here's the classification based on nucleic acid. Okay, DNA virus and RNA virus. This is the classification. The virus which have DNA are DNA virus. The virus which have RNA as nucleic acid are RNA virus. So there are 6 families of DNA virus. And there are 14 families of RNA virus. First you learn that. 6 families, 14 families. Family contain multiple members. But you first learn the families. Okay, I'm having a mnemonic here. I'm having a mnemonic here. Please learn the DNA viruses, RNA viruses separately with the help of mnemonic. You people even don't know which virus is DNA, which virus. How you will learn their details? First you know the basic. Which virus is DNA? Which virus is RNA? Which is single-stranded? Which is double-stranded? Huh? So see the DNA viruses. What are the 6 families of the DNA viruses? What is the mnemonic? The mnemonic is double H A triple P. The mnemonic is double H A triple P. I cannot mark it. Okay, if you make it Y, it will be happy. Double H A triple P. The first H is herpes. The second H is hepadina. Herpes, hepadina. A is adeno. A is adeno. Triple P. You can see the triple P. The 3 P's are there. Pox, parvo, pepova. Again I say, these are families, people. They contain multiple members. I'm not going in the member because when I will teach you detailed virology, I will take the family and teach you all the members in that family from tomorrow onwards. So first you learn the family. Double H A triple P. Okay, herpes, hepadina, adeno, pox, parvo, pepova. Please learn that. Learn the 3P very carefully because I will tell you 2P in RNA viruses, total 5P. P is very dangerous in virology. You get confused. Got it? These are the 6 families of DNA virus. Now coming on the 14 families of RNA viruses. Can I come on the 14 families of the RNA viruses? Yes. So let's come on the 14 families of the RNA viruses. What are the 14 families of RNA viruses? The mnemonic is ABCD, FOR. ABCD for TP. PP or PT. Okay, if you have a better mnemonic, kindly share. Otherwise, I can make this. Okay, ABCD. So C is 2. Double C is there. You can see double C. F is also double. And P is also double and R is 3. If you count, total will be 14. Say the full form. Say the full form. A stand for arena. B stand for bunia. The 2C stand for Kelsey and Corona. D stand for Delta. D for delta. The 2F is for philo and flavi. O for orthomixo. The 3R, triple R is for Rio, Rhabdo, Retro. T for toga. And the 2P is paramixo and picorna. How to learn that? I will write with you. Don't worry. Okay, if I can learn, I guess you are younger brains than me. Okay, you can definitely learn. Let's try. Let's try together. Okay, it is easy. If you learn the mnemonic, it's very easy. So tell me the 6 families of DNA viruses. And tell me the 14 families of RNA viruses. 6 families and 14 families. What are the 6 families of DNA viruses? What is the mnemonic? Double H, A, triple P. Okay, that is the mnemonic. What is the mnemonic for RNA viruses? The mnemonic is A, B, C, D, F, O, R, T, P. C double, F double, P double, R triple. Total 14 are there. First you learn the mnemonic. Very basic. If you have learned the mnemonic, half job is done. Now the remaining half job, you have to say the full form. Just say the full form. By the way, the mnemonic I have written, it's gone. Shall I write it again? That page is gone by mistake. Quickly I will write it. Chalo. Double H, A, triple P, A, B, C, D, F, O, R, T, P. Okay, quickly we will say the full form. Here the double H is herpes hepatna. Here also we have A, here also we have A. But here A is adeno. Here A is arena. D for DNA, R for RNA. You don't confuse. D for DNA, R for RNA. So adeno, arena, adeno, DNA, arena, RNA. No confusion. Okay. The triple P is a real confusion here. The triple P here is pox, parvo, and pepova. That you have to learn. I don't have any trick to learn that. And here the double P. Double P. Here we have 2P. What are the 2P here? Picorna and paramixo. Picorna and paramixo. Okay. And apart from that, we have bunia, Kelsey, corona, delta, philo, flavi, orthomixo, Rio, Rhabdo, Retro, toga. It's very easy. If you learn the mnemonic, it's very easy. Now learn the members inside that. Families are not important. You have to learn the members. Count. I will tell you each and every member from tomorrow onwards, system-wise. Don't you dare to miss it. Okay. And I will teach you all the viruses. All DNA, all RNA. See the members. See the members. I will divide them according to their systems. I will do a color coding. 8 colors, 8 systems. Red, orange, blue, purple, pink, green. I have done a color coding. So I have provided one color to each system. And I have arranged all the bacteria, virus, fungus, parasite according to the color system. And you will understand it tomorrow better. Okay, chalo. So let's start. Now I will tell you 5 things. If you learn the classification, then you are allowed to attend my further session. If you have not learned the classification, you will not understand it. I'm sorry. Okay. Now you have to understand these 6 things based on the classification. Now you tell me, I assume everyone know the 6 families of DNA virus. You know the full form? Yes. Everyone know the 14 families of RNA virus. You know the full form? Yes. Among them, who are single-stranded, who are double-stranded? Among them, who are single-stranded, who are double-stranded? Very commonly asked MCQ. Now I don't know that. Suppose I will use my common sense. I'm having common sense. Okay, I will use that. Now from my childhood, I know in my school time, DNA is a double-stranded molecule. And RNA is a single-stranded molecule. Okay, RNA is a single-stranded molecule. We know that, I guess, from our school time. So according to my general knowledge of common sense, all DNA viruses should be double-stranded. Because DNA is a double-stranded molecule. And all RNA viruses should be single-stranded. That's my common sense says. Yes, common sense is correct most of the time. Okay, it is correct, except one. So here we have one exception and except one. Here we have one exception. So out of the 6, 5 will come here. And out of the 14, 13 will come here. So tell me one exception, quick, people, quick, fast. And that's your MCQ. That's your question. So here the exception is parvo. Parvo is the gaddar here. Parvo. Parvo virus is the DNA. It was supposed to be double-stranded, but it's single-stranded DNA. सुनने में कितना अजीब लगता है? Single-stranded DNA. Yes, it is true. Got it? What about this? Here, the exception is Rio. Rio is the gaddar here. Rio is the exception here. So, Rio virus is an RNA virus. It was supposed to be single-stranded. RNA is a single-stranded molecule, but no, it is a double-stranded RNA. Yes, double-stranded RNA. Can it happen? Yes. So, Rio virus is a double-stranded RNA virus. So, read it. All DNA viruses are double-stranded DNA except parvo, which is single-stranded DNA. All RNA viruses are single-stranded RNA except Rio, which is double-stranded RNA. You get question here, you get question here. Maybe these are your quiz question. Maybe these are your test question. Please learn them wisely. Okay, here only I am asking. I will not ask them in the quiz. Read the question. Which of the following is a single-stranded DNA? See the question. Single-stranded DNA. Can you tell me the answer? I guess just now I told you I am asking single-stranded DNA. What is the answer? Of course, the answer is parvo. And which of the following is a double-stranded RNA? Just now I told you. Normally RNA is single-stranded, but I am asking double-stranded RNA. So answer is Rio. Very frequently asked MCQs in your competitive exams. Okay. Now the next question. Second point. Okay. You know the 6 DNA and you know the 14 RNA. Okay. Among the 6 DNA, who's the smallest? Who's the largest? Among the 14 RNA, who's the smallest? Who's the largest? Okay. Let me give you a clue. I'm not so cruel. I will give you a clue. So clue, they all start with P. Actually, it's not a clue. It's a confusion. They all start with P. That's why I told you, beware of P in virology. Okay, all 4 option ABCD will be of P. Okay, it's a confusion. It's a real confusion. So we have to make some story to learn that. Otherwise, if I just tell you the names textually and I ask you to learn it however you want to do, so it is of no use. In the exam, definitely you will confuse. So I have to frame a story so that you can learn it. So let's frame a story. Okay, let's frame a story. So I will call the smallest as newborn. Okay, and I will call the largest as grandfather or the senior citizen. Okay, here also newborn and senior citizen. So among them, who's the newborn and senior citizen? I will continue the story in the next concept also. Okay, got it. Who's the senior newborn here? The newborn here is one of the P. Parvo. You learn parvo is a little girl born today. Parvo, maybe a boy, maybe a girl, I don't know. Parvo is a newborn born today. It's a very cute, small newborn. Parvo. And who's the grandfather? Grandfather is Mr. Pox. The age is 100 years. He's more than 100 years. The most senior citizen of the city. Mr. Pox. It's 100 years. Learn like a story. Okay, you will not forget. Come on the RNA. Okay, among the RNA, who is the newborn? Who is the grandfather? The newborn and grandfather both are PP. Okay, the newborn. You know, in mathematics, have you read what is nano? What is deca? What is pico? Padha hai sab mathematics mein 9, 10th standard. Nano stand for -9. Deco stand for -10. What is pico? 10 power -12. Very small. So here smallest is picorna. Picorna. It is not picorna. It is picoRNA. Read it, picoRNA. It's a RNA virus which is pico. Pico means 10 power -12. It's very small. You will not forget now. Okay, so the newborn here is picoRNA, or you can say picorna. PicoRNA is picorna. Got it? And the largest here, Mixo ke bade bhaiya. The elder brother of Mixo. Paramixo. Paramixo. Mixo, the elder brother. Paramixo. Okay, senior citizen. But 60-year-old. 60, 70-year-old. It is not as senior as 100-year. Okay, so we have 2 newborns, we have 2 grandfathers. Let's do the competition between them. We will compete them. So let's compete the 2 newborn. Let's compete Parvo with the Picorna. Let's compete the 2 newborn. Who's more smaller? Who's more smaller? This one is 1 day. This one is 1 month. Okay, this is newborn born today. And this is you can say, this is the 1 month old. So who is more small? So Parvo only. The one who is DNA, that is overall smallest. Let's do the competition between 2 grandfathers. Who is more senior citizen? Okay, Pox, Mr. Pox or Mr. Paramixo? Who's more senior citizen? Of course, Mr. Pox, 100-year-old. So here also the DNA one is the overall. So 6 questions, 6 answer. Rather than passively writing or reading, let's write it. 6 question, 6 answer. Listen my 6 question. Tell me the smallest. Tell me smallest DNA. Tell me smallest RNA. And tell me smallest overall by computing that. Okay, these 3 questions. Next 3 questions. Tell me largest DNA. Okay, tell me largest RNA. And tell me largest overall. The next 3 questions. Tell me the 6 answers in the sequence, people. Fast. You have to be fast enough. Fast and accurate. Fast. Everyone please answer. Everyone please answer. So smallest DNA is cute little girl born today. Parvo. Smallest RNA. PicoRNA. 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 Compete them. Who will win in the competition? Compete them. Who's more small? It's Parvo only. It's Parvo only. Okay? Now largest DNA, Mr. Pox, senior citizen. Largest RNA, Paramixo. Paramixo. Compete them. Who's more large? Mr. Pox only. So don't confuse in your exam. People, 6 questions, 6 answers. Learn them with a story, however you can do, but be clear in your concept. You have to be clear in your concept. Okay, you can't be confused in the exam. Now, you can see the MCQ. I will not hold on the MCQ. They're very simple. Listen, the virus with the smallest genome. If nothing is written, I mean overall. If nothing is written, I mean overall. Who's the smallest? Overall. So of course the answer is parvo. If I add DNA, would you like to change your answer? Yes or no? So DNA is this only. So overall is also this. DNA is also this. But if I change the question to RNA, what's the answer in that case? In that case, your answer becomes picorna. So 3 questions, 3 answers. Okay. Now the next concept. People. Next concept. Very tricky. Here, everyone. Out of the 6 DNA, how many are enveloped? How many are naked? Out of the 14 RNA, how many are enveloped and how many are naked? People, how many are enveloped? How many are naked? Learn a concept. Learn mnemonic. The mnemonic is naked is always 3. Okay. Enveloped, don't call non-enveloped. I don't like you call here non-enveloped because there is a trick behind that. You just say naked. Non-enveloped is naked only. I told you, there are 2 types of virus, the enveloped one and the non-enveloped. The non-enveloped are naked. Naked is always 3. Here also. Now common sense. Out of 6, 3 are naked. So obviously 3 will be enveloped. Out of 14, 3 are naked. So obviously 11 will be enveloped. Got it? Don't learn the enveloped. I will not tell you this list. I will not tell you this list. I will tell you the list of naked. Learn. Naked is always 3. Learn the list both the ways. Okay, list is very easy. Full form of the list is tricky. Okay, so here naked is pop. Learn the mnemonic naked is pop. Very easy. And here learn the mnemonic naked is PCR. In DNA, naked is pop. In RNA, naked is PCR. Okay, now what is P? I told you, I warned you, I threat you. P is a confusion in virology. Okay, so beware of P. Okay, so what is this P? How many P we have? Total 3 P. So 2 are here. So obviously 1 is here. No? 1 is here along with the 2H. 1 is here. Now which 2 are here? Which 1 is here? That's the challenge to learn. Examiner knows this trap and you get all the P in the option only. P. Okay, now see. Use your common sense. Okay, my common sense says babies can be naked. It's okay if baby is naked. What is the big deal in that? Babies can be naked. No? But grandfather, give respect, give clothes, give envelope. Grandfather cannot be naked. Okay, we will give envelope to the grandfather. Okay, so give clothes. So that common sense you have to apply. So that is my common sense you have to apply. So who's the grandfather? Mr. Pox. So Pox have the envelope. Who's the baby here? Who's the newborn? Parvo. So Parvo is naked. It's okay. And what about this next P? Papua. Papua is a toddler, not a newborn, but a toddler. If the toddler is also naked, what's the big deal in that? Okay, so Parvo and Papua are naked. But Mr. Pox, no, don't you dare. Okay, so give envelope, give clothes. And here A is adeno, there is no confusion in that. Only one A is there, adeno. So no confusion. So learn Parvo, adeno, Papua. Learn. Now you will not forget. I told you the story, no? Okay, so every concept you have to learn with a story. You have to correlate with some story so that you don't confuse in the exam. In the exam, you will remember me. You will remember my story very fast and you will come on the correct answer. Even in the option Pox is there, you will give respect to the Pox in the options also. Okay, so Pox, senior citizen, give clothes, give envelope. Okay, so here we have Parvo, Papua and adeno. PAP, P-A-P, PAP. Got it? Come the side, quickly come the side. The same concept you apply. How many P we have? 2 P. So 1 is here. So obviously 1 is here. Obviously, now which one is there? You will tell me. Apply same concept. What about C? We have 2 C. 1 is here, 1 is here. Which one here? What about R? We have 3 R people. 1 is here. The remaining 2 are here with all others. So that is the challenge. Which one is here? Which one? So that is the challenge. Learning PCR, even a KG kid will know that RNA naked virus are PCR. Learning mnemonic is not important. Learning the full form of the concept is important. Got it? For P, apply the concept. Apply. Who's the newborn here? The newborn is picorna. It's okay if picorna is naked. What's the big deal? Who's the grandfather? Mr. Paramixo. Give respect. Give clothes. Give envelope. Grandfather. Senior citizen. Got it? The same concept we have applied here. This one is Mr. Fox and this one is Parvo. Got it? So for P, we have the concept. For P. So this one is picorna and this one is Paramixo. There is no confusion in that. No confusion. What about C? What are the 2 C? Calci and corona. Recently, we have a pandemic of corona. I guess everyone is aware of that. We have served so much. We have worked so much in that period. The pandemic, we have corona. How corona pandemic is gone successfully? How it is gone? Have you ever thought? Because we have used judiciously the sanitizer. How sanitizer kill coronavirus? What is the mechanism? We have sanitized everything, all the articles, including ourselves. Sanitize. How sanitizer killed the corona? Thankfully, the God has given envelope to the corona. Sanitizer dissolve envelope and the virus get killed. Imagine if God has not given envelope to the corona, we cannot kill it with sanitizer. So with this concept, you learn that coronavirus is envelope. And that's why sanitizer can dissolve the envelope. But calci don't have the envelope. Okay, and R, I don't have any concept, unfortunately. Please learn R. Naked is Rio. The remaining rhabdo and retro. The rhabdo and retro are enveloped. And Rio is naked. So learn the full form of PAP, learn the full form of PCR. I hope this concept is also done. Yes? So see, out of the 6 DNA, learn PAP is naked. Okay, don't learn this one. Learn PAP is naked. Obviously, whatever pending list, that will go in envelope. Out of the 14 RNA, learn PCR. PCR is naked. Obviously, the remaining 11 will come here. But what is the full form of PAP? What is the full form of PCR? Give me a thumbs up, people. I told you how to learn it. It is a trick. It's a story. Now the next concept. Coming on the next concept. Out of the 6 DNA, how many have segmented genome? And out of the 14 RNA, how many have segmented genome? Here the answer is 0. None of them. None of the DNA virus have segmented genome. None. They all have complete genome. They are not in pieces. But out of the RNA, 4 of them, out of 14, 4 of them have segmented genome. Which 4? Which 4 have segmented genome? So I'm having a mnemonic. The mnemonic is Bora. You can learn the mnemonic. Bora is in pieces. Bora is fragmented. Bora is segmented. Bora is in pieces. B-O-R-A. Bora is in pieces, fragmented, segmented, whatever you say. Got it? So B for Bunia. Only one B. No confusion. O for orthomyxo. No confusion. By the way, orthomyxo is influenza virus, if you know. The member is influenza. Okay. A is arena. No confusion. But always the confusion is R, no? And everywhere R is Rio. Out of the 3, Rio is coming here. So Bora, B-O-R-A. Bunia, orthomyxo, Rio, and arena. Got it? Now, people, tell me the number of fragments. How many fragments? RNA. They all have RNA. Obviously, they are RNA viruses. But tell me the number of the fragments RNA is in. Okay, so you have to learn like how you will learn. Here you have to learn 3 and 8. 3 plus 8 is equal to 11. 3 plus 8 is equal to 11. And 1 plus 1 is equal to 2. This is how I learn. So learn the first 2. 3, 8. Bora, 3, 8. 3 plus 8 is equal to 11. And 1 plus 1 is equal to 2. So this is how you can learn. Appreciate it. People, appreciate. So B-O-R-A. Bunia, orthomyxo, Rio, and arena. B-O-R-A. 3, 8, 11. 3 plus 8 is equal to 11. And 1 plus 1 is equal to 2. Actually, it's 10 to 12. But you can learn 11. Now you get image-based question on that. Identify the virus. Spotter. Identify the virus. So I can say it is fragmented. It's RNA. It's fragmented. I can't say it's RNA or DNA, but it's fragmented. So I will count. 1, 2, 3, 4, 5, 6, 7, 8. 8. It's orthomyxo or influenza. Similarly, I can get a question on 3 fragments, 2 fragments, likewise, or 11 fragments. It's an image-based Potter question. How many of you got it? Got it? Can we go ahead? So that is the virus. The last concept here is the symmetry. Symmetry of the viruses. The last concept here is the symmetry of the viruses. Okay. So viruses have one of the 3 types of symmetry. Either helical symmetry or icosahedral symmetry or complex symmetry. What is helical? Helical is like a corkscrew. Can you see? It's like a corkscrew, like this. Helical is like a corkscrew. Can you see? Icosahedral. This one is icosahedral. What is icosahedral? It's a diamond. Have you seen a diamond? It's diamond shape. It's equilateral triangle. Can you see? So there are total 12 equilateral triangles. Some are visible here, some are behind. 12 equilateral triangles with 20 corners. You can count the corners. 20 corners. Such a figure is known as icosahedral. 12 equilateral triangles with 20 corners. Icosahedral. And if it is not this, any other shape is complex. Complex don't have any fixed shape. Okay, you got it. But that is not the question. That was not the question. The question is this. Okay, got the question. Let me explain the question. Out of the DNA, 6 DNA, how many are helical, how many are icosahedral, how many are complex? That is the question. Got it? Out of the RNA, the 14 RNA, the same thing. How many helical, how many icosahedral, how many complex? From tomorrow onwards, people, I will start systemic microbiology, a very big deal. I cannot teach you the morphology. You cannot learn the morphology of individual viruses. I will teach you 39 viruses. Okay, in next 6 days. Okay, you cannot learn 39 times the morphology. Learn it once for all. Done, 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 done. In the next 39 times, we will revise it quickly. But we don't have to learn it. That is the way of understanding microbiology, the most volatile subject out of the 19. But I will make a fun game for you, microbiology. Okay, it will be very easy to remember without touching the book. Mark my words, just master chart. Hang it on your wall. Keep on flipping the pages. And whatever I'm telling you, just see in that corresponding columns. Done. You will understand it better tomorrow. Let me come. Okay, I'm eagerly waiting for tomorrow. And let me introduce the magic of my master charts. Okay, chalo. Let's come here. How to learn the symmetry. Okay, now, you know, D for DNA, D for diamonds. Diamond. Learn the mnemonic. Make a concept. D for DNA, D for diamond. All DNA virus. Out of 6, 5 of them are diamonds. Diamond mane icosahedral. 5 of them are diamonds, except one. Senior citizen. Who is the senior citizen? Grandfather. Mr. Pox. Mr. Pox says, no, I am senior. I will take a complex symmetry. You all become diamonds. So Mr. Pox is complex. Rest all are diamonds. Rest all. And none of them is helical. None of the DNA is helical. DNA viruses are not helical. Okay, most of the DNA viruses, 5 of them are icosahedral, except Mr. Pox, who is complex. Now, dear, helical is feeling very bad. Learn like a story. Am I so bad? None of the DNA virus allotted to me. We say it's okay. We will compensate in RNA. Okay, so among the RNA, we will allot 11 enveloped RNA to the helical. Now, only 3 are pending. The naked one, PCR. The naked PCR are diamonds. The naked PCR are diamonds and none of them is complex. So this is how you can learn. I hope you all got it. People say yes, no, but say something. Got it? So see, this is how. If I tell you the textual, you will forget. But in this format, you will not forget. See, all DNA viruses are icosahedral except Pox, which is complex, and none of them is helical. Okay, all enveloped RNA virus are helical. And the naked one are diamonds, PCR, and none of them is complex. I hope you got the concept. Everyone give me a thumbs up. Come on. So what we have learned in the last 20 minutes, we will revise in the next 2 minutes. Everyone here on your gadgets, concentrate what I am saying. Say the answers quickly. You know the 6 DNA? Yes. You know the 14 RNA? Yes. So tell me, among the DNA, how many are single stranded, how many are double stranded? Among the RNA, how many are single, how many are double? Use common sense. All DNA are double and all RNA are single except one. Here the exception is parvo. And here, the exception is picorna, if I am not wrong. Yes, if I am doing any mistake, kindly correct. Got it? Chal. Who's the smallest, largest, smallest, largest? Here, the smallest is the parvo, the little gun born today. Here, Mr. Pox, senior citizen. Here it is picorna, pico RNA. Okay, and here it is Mr. Paramyxo. And if you compete them, the DNA one are the smallest and largest overall also. Okay, now who is enveloped naked? Enveloped naked, naked is always 3. Naked is always 3. Here naked is PAP. You know the full form, I am not repeating. And here the naked is PCR. You know the full form, I am not repeating. Okay. Segmented, 0. Segmented, 4. Which 4? Bora. B-O-R-A, Bora. Not only this. 3, 8, 11. 1 plus 1, 2. I hope you got it. Okay. Symmetry. All 5 are diamond except Pox, which is complex. None of them is helical. So helical is feeling bad. A lot 11 enveloped viruses over here. The 3 naked PCR is icosahedral and none of them is complex. I hope everyone got it. Okay, I need an applause on this concept. You get many questions on that. Please react. Got it? Everyone, any confusion? Say yes, no, but kindly respond, people. Show me some energy. So this is the answers. General virology. Most of the general virology packed on one page. Everyone, got it? Now, the next concept, replication of the virus. The next concept is replication of the viruses. There are 7 steps. I will show you a video also. There are 7 steps in replication of virus. Please learn the basic rule. The basic rule is that virus cannot replicate outside the host cell. Host cell can be human, can be animal, but virus replicate inside a living cell. Virus always replicate inside a living cell. You are getting it? Virus always replicate inside a living cell. See this yellow cell. It is a human cell, or you can say it's a host cell. Where is the virus? Where is the virus? Appreciate the virus. Let me see if I can use the highlighter. I guess I can. Oh, thank you. See the virus. I will show you the 7th step. So this yellow cell is a host cell. First step is attachment. Virus is coming and attaching it here. Okay, the first step is attachment. How this highlighter will go? Just a second. You can see this is the virus. First it is coming and attaching with the host cell. First step is attachment. Receptors. Specific receptors are there. For example, HIV virus bind with CD4 receptor of the host cell. For example, influenza virus, flu virus bind with the sialic receptor of the respiratory tract of the human. So they have specific receptor present on the specific host cell. They cannot enter in all the cell. They have specific receptor. The first step is attachment. Second step is penetration. Appreciate the virus is penetrating. With the help of endocytosis, it is penetrating. It is making a envelope and it is penetrating. The third is uncoating. After that, the capsid will separate, nucleic acid will separate. This is known as uncoating. The separation of the capsid and nucleic acid. This is known as uncoating. Then biosynthesis. Multiple copies of capsid are formed and multiple copies of nucleic acid are formed using the host machinery. Using the host metabolites and host machinery. Multiple copies of the nucleic acid and capsid is formed. The next is assembly. In the assembly, one nucleic acid, one capsid. One nucleic acid, one capsid. One nucleic acid, one capsid. They will combine. Then they will mature for some time. The next is maturation. They will mature here for some time, for few hours, for few days. And after that, they will rupture the host cell and come out. The host cell is gone. And this is how virus cause disease in humans. So tell me the 7 steps. What are the 7 steps? I will show you a video after that. 1, 2, 3, 4, 5, 6, 7. Tell me the 7 steps. People fast. What are the 7 steps? First is attachment. Then penetration. Then uncoating, in which the capsid separate, nucleic acid separate. Then biosynthesis. The most important step is biosynthesis, in which multiple copies of capsid and multiple copies of nucleic acid is formed. Then assembly. One nucleic acid bind with one capsid. Then maturation. They will mature for some time. The last is release. Most important, in which lysis occur. The host cell gets ruptured. Okay, now see this video. Appreciate it. Okay, you can see this is virus, this is host cell. The first is attachment. It is coming and attaching over here. Appreciate the specific receptors. This step is attachment. Now it will penetrate. Okay, penetration is there. It is penetrating. Appreciate the penetration. It's penetrating inside. Can you appreciate it? It's slow, but appreciate it. It's penetrating. After that, uncoating is not shown here. The nucleic acid and capsid will separate. Uncoating, then biosynthesis. They appreciate the multiple copies. The multiple copies of the nucleic acid and capsid is formed using the host machinery. Then appreciate the assembly. One capsid, one nucleic acid, one, and they are maturing. Now they will do the lysis. They appreciate the lysis, and they are coming out. I hope all 7 steps are clear. Now, if you understood the normal cycle, okay, if you understood the normal replicative cycle, you will understand the abnormal replicative cycle. Abnormal. Appreciate it's abnormal. This is not normal. Normal, I explained you. Abnormal replicative cycle. Now, viruses are very ethical people. They have more ethics than human also, I must say. What is the ethics they have? When one virus enter in one host cell, the other do not dare to enter in the same cell. Okay, when one virus is already inside the one host cell, one human cell, other do not enter. Other virus see from outside, one of the viruses is already there. No, I will search some other host cell, I will not enter there. That is the ethics of the virus. Never forget. Got it? Now listen, apply these ethics here. Some viruses forget their ethics. For example, influenza virus. So sometimes multiple influenza virus enter in one host cell. Okay, then this will happen. If multiple, not one, multiple influenza virus, orthomyxovirus, influenza virus, enter in one host cell, what will happen? Dhakka-mukki, overcrowding. All the 7 steps of all the viruses will take place. All viruses will attach. Okay, they will penetrate, they will do uncoating, biosynthesis, maturation, assembly, and release. So there will be dhakka-mukki. All the 7 steps is repeated for all the viruses. Okay, there will be overcrowding inside, So step number 5. Okay, there is abnormal assembly take place. Because of this overcrowding, the assembly wala step, this step, assembly, step number 5, that will become abnormal because of the overcrowding. Okay, this assembly wala step, when multiple influenza virus with high dose influenza virus enter in one host cell. Okay, that assembly wala step become abnormal. So whatever progeny is formed here, that progeny is abnormal. The progeny is abnormal. Okay, this progeny is abnormal because it is due to abnormal assembly. What is abnormality in this progeny? This progeny is of low infectivity. infectivity is very low. It's an abnormal progeny, abnormal daughter cell. Okay, and it is having more papilloma. Okay, papilloma are the spiky projections on that. So see, so it is having high papilloma and low infectivity. Hemagglutinin is the papilloma. It is having high papilloma, high hemagglutinin, and low infectivity, and this is known as von Magnus phenomenon. The scientist who discovered it, von Magnus phenomenon. It's the abnormal replication. Out of the 7 steps, which step is abnormal? You have to learn that. I hope you all got it. Okay, you can see these are papillomas. Papillomas are the projectile, spiky projections. They are of 2 types, HA and NA. I will teach you in influenza virus. Okay. Now, the last thing here I'm telling you is inclusion bodies in general virology. After that, general virology is also done. So the last thing here I'm telling you is inclusion bodies. What are inclusion bodies, people? Huh? What are inclusion bodies? Everyone have heard the name, but how many of you know the meaning of inclusion bodies? Suna to sabne hai. Every medical student know inclusion body, but how many of you understand? I think very few of them, or none of you. Huh? What is the meaning? What is the meaning of inclusion body? Let me explain. See here. Can you see the 7 steps of replication? Say yes. Can you see the 7 steps of replication? This is the entry of the virus. Okay. And this is the exit of the daughter virus. Okay. One virus enter and multiple daughter virus or virion or daughter virion come out. One is entering and multiple are coming out. This is entry, this is exit. Now my question to all of you. Can you see the virus between this duration? This duration is known as eclipse phase. The duration between entry and exit is known as eclipse phase. My question to all of you, can you see a virus in light microscope during eclipse phase? Huh? Can you see this virus? My answer is no. My answer is no. I cannot see because after going inside the host cell, the virus is fragmented. The virus is fragmented into multiple pieces. उसके चिथड़े उड़ गए हिंदी में बोले तो. It is fragmented. Okay, nucleic acid is separated, capsid is separated, envelope is separated. All the things are separated. I can't find the intact virus inside the host cell. So how can I see a virus? I can't see a virus. So what I can see? I can't see a virus. But I can see dot 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 dot. These dots are inclusion body. The chithde of the virus is the inclusion bodies. You got it? So what does they indicate? So if inside a human cell, I am getting these dots, I'm getting these dots inside a human cell. It indicates, it's an indirect indicator that virus is multiplying inside that cell. That cell is virus infected. I can't see a virus, but I can see dot, 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 dot. And that is the indirect indicator that virus is trying to multiply inside that cell. It's a virus infected cell. We can use this for diagnosis. Okay, although it's not a direct indicator, but it's an indirect indicator. That is the meaning of inclusion body. The chithde of virus, the dot, 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 the fragments of the virus. Got it? Now, how many types of inclusion bodies are there? There are 3 types of inclusion bodies. How many types of inclusion bodies are there? There are 3 types based on their location in the host cell. See the 3 host cells. These are the 3 host cells. Okay, now see where are the inclusion bodies. The inclusion body can be in the cytoplasm. Okay, you can see it's intracytoplasmic. It can be in the cytoplasm. It can be inside the nucleus. Okay, it is intranuclear, or it can be both. It can be in the nucleus as well as in the cytoplasm. It can be both intracytoplasmic as well as intranuclear. So there are 3 types of inclusion body based on their location. They can be intracytoplasmic in the host cell. Okay, they can be intranuclear in the host cell. They can be both. The fragments of the virus can be anywhere. Chithde kahin bhi ho sakte hain. Inside the human cell, they can be in the cytoplasm. They can be in the nucleus. They can be both. Now, nobody is going to ask you this. Okay, this was for your concept. What they will ask, examiner will ask the examples. You have to learn 5 examples over here at the tip of your tongue. नींद से उठा के पूछे तो भी याद आना चाहिए. The 5 example of intracytoplasmic inclusion body. This is something you can't skip before your exams. Okay, you have to learn 5 examples over here again. Okay, and you have to learn 2 examples. Total 12 examples of inclusion body at the tip of your tongue. Learn the 12 examples. 12 examples. 5, 5, 2. Okay, now you have to learn. It's not conceptual. You can say it's factual, but I will make it easy how to learn. So coming on the 5 examples of intracytoplasmic. The 5 examples of intracytoplasmic inclusion body. What are the 5 examples? Learn 5 viruses first. Then I will tell you their example. One of them is RNA. The remaining 4 is DNA. You know which is DNA virus, which is RNA virus till now. Huh? One of them is RNA. The RNA is rabies, rabies, and remaining are pox, senior citizen. These all are the members of pox. Now go and see the classification in the notes. And in the classification, you see what are the members of the pox virus. These are the members of the pox virus. You can see vaccinia, variola, foulpox, and molluscum contagiosum. Okay, these all are members. They are pox virus. The total 5 virus. Say the 5 virus. Say one is rabies and 4 of them are pox virus. Variola, vaccinia, molluscum contagiosum, and foulpox. Okay, these are the 4 pox virus. Now say the name of the inclusion body in them based on the scientist who discovered it. In rabies, it is discovered by Negri, so known as Negri body. In vaccinia, it is Guinneri because it is discovered by Guinneri bodies. In variola, it's Paschen body. In foulpox, it's Bollinger body. And in molluscum contagiosum, it's Henderson-Peterson. So, ma'am, how to learn it? It's very easy. Let me tell you a trick. Okay, everyone knows rabies mein Negri hai. Ye to bacche ko pata hai. Even a kid knows that. In the rabies, there is a Negri body. Where is the confusion? Whenever there is a confusion, you make a trick there only. You don't try to make trick everywhere. You make trick wherever there is a confusion. Confusion is in vaccinia and variola. Okay, both are VV. Here also V, here also V. Okay, confusion is there. So I'm having a mnemonic. Gori had a vaccine. Guinneri is in vaccinia. You will not forget now. Gori had a vaccine. Okay, so Guinneri is in vaccinia. Done. Remaining are easy. I guess you can learn them. I will fill it in the end. Okay, coming on the next. The next is intranuclear inclusion body. They are of 2 types. Cowdry A, Cowdry B. Now you will say, ma'am, ye kaise aa paaye? What are the 2 types? Cowdry A, Cowdry B. Both are intranuclear. Only words are catchy. Okay, they're very easy. Let me tell you. So this is host cell. This is host cell. This is nucleus. This is nucleus. Both are intranuclear. Okay, but this one is like this, and this one is like this. Okay, I mean Cowdry A is granular. Okay, and Cowdry B is circumscribed. Circumscribed. That's it. Granular, circumscribed. So this one is Cowdry A and this one is Cowdry B. So both are intranuclear only, but one is granular, Cowdry A, and one is circumscribed, Cowdry B. I hope you got it. So you can see Cowdry A is granular and Cowdry B is circumscribed. Both are intranuclear only. Both are intranuclear only. Okay, learn. Total 5. 2 of them are Cowdry A and 2 of them, total 4 are there, I'm sorry, 2 plus 2. Okay, so here the mnemonic is high and here the mnemonic is pa. Hypa. Hypa is the mnemonic. As for herpes and Y for yellow fever. Okay, herpes mate is known as Lipschul's body and yellow fever mate is known as Tori's body. Lipschul's body, Tori's body. Okay, and pa is polio and adeno. Here we don't have specific name. Polio and adeno. Hypa is the mnemonic, and come on both. Intranuclear as well as intracytoplasmic. Only 2 viruses, measles and CMV. Okay, in measles it is known as Warden-Finkelday. The scientist who discovered it, Warden-Finkelday. And CMV, cytomegalovirus, it's known as owl eye, ullu ki aankh. Owl eye appearance. Can you appreciate the owl eye appearance over here? Appreciate. So this is the host cell. Inside the host cell, this is the nucleus. It is present inside the nucleus also, and it is present in the cytoplasm also. It's owl eye appearance inside nucleus as well as cytoplasm. Got it? Can you help me in filling, people? Chalo, we will revise quickly. Let's see who was attentive. Come on, chalo. The 3 type of inclusion body. Tell me 5 examples in intracytoplasmic. Tell me 5 examples in intranuclear. Cowdry A. I'm sorry, 4 examples over here. Cowdry A and Cowdry B. And tell me 2 examples over here. So total 11 examples will be there. Come on, we will try together. So here one is RNA. That is rabies, and remaining 4 are DNA. What are the remaining 4 DNA viruses? Can you tell me? So it is what were the remaining 4 DNA viruses? Variola, vaccinia, foulpox, and molluscum contagiosum. Now tell me the name of the inclusion bodies in that. Can you tell me? Rabies mate is known as Negri body. Variola, vaccinia. Gori had a vaccine. Gori, Guinneri. Gori, Guinneri. Here it is Paschen. Here it is Bollinger body. And molluscum contagiosum, Henderson-Peterson. This is how I learned. And here it's very easy. How it is? Hypa. Hypa. Okay. Herpes, yellow fever, polio, adeno. In herpes, it is known as Lipschul's body. In yellow fever, it is known as Tori's body. Here we don't have any name. Okay, the last one, both. In both, here we have 2 viruses. We have measles over here and we have CMV over here. What it is known as? In measles, it is known as Warden-Finkelday. Warden-Finkelday. And here it is known as owl eye. I know it's more of factual. Okay, but you have to learn it. You don't have any option. Chalo, read the question, tell me the answer. Be fast. Read the question, tell me the answer. Be fast. Let me see who is the first. Let me see who was attentive. Can I read the question for you? Both intranuclear and intracytoplasmic individual bodies are seen in. Just now I taught you. Yes, you all are right. The correct answer is measles. Measles and CMV. In measles it is swarmed and painted. Okay. Okay. So we are done. I guess. Just a second. Give me a minute. Let me see what else. That's it. Let me do an important announcement for your quiz. For the free master charts. So that was the introduction, the first session of FinalGear Microbiology, the 25-hour rapid revision crash course. You got an overview how I'm going to complete the entire microbiology in just 25 hours. So today we have a 3.5 hour or maybe approximately 4-hour session. Likewise, we will be having 4-hour session. 4 hours, 6 to 10 p.m. Okay, on these dates. You appreciate the dates. You see the schedule. Okay, you can appreciate the schedule over here. Okay, so today's session is done, 11th July, on YouTube, General Microbiology. I covered General Bacterial, General Viro. That was the major portion. So 90% of that is covered. General Parasite and General Micro, we have only classification to be covered here. Classification and overview of lab diagnosis, that's it. The remaining I will cover in the systemic. This portion I will put as a recording on the app. Maybe it is a half-hour recording. Okay, and the 4-hour is done over here. Got it? So this portion is done. Now tomorrow, 12th July, again we have a session on YouTube. Don't you ever dare to miss it. Okay, tomorrow's session, it's very special because not only in this session, I will cover only this one system, CNS infection. I will teach you bacteria, virus, fungus and parasite which are associated with serious. In bacteria, I will cover salmonella, rickettsia, brucella, leptospira. Virus mein most important HIV. With all arbovirus I am going to cover. Fungus mein I will cover all, systemic histo, blasto, coccidio, paracoccidio, candidiasis. Okay, and in parasites, I will cover the malaria, most important, babesia, and all other blood parasites. So I'm going to cover nearly 20 to 25 microorganisms tomorrow. But you will understand the approach. If you are not attending the further course, it's okay. It's okay. But you please do attend this session because it will be beneficial for you. Whether you are targeting your university exam or you are targeting your NEET, PG, FMG or INICT. Okay, this session is going to be super useful for you because you will learn the approach, how to compact the microbiology and retain it. I will tell you a magic way in the form of the master chart. You can make it of your own also. Okay, this is a copy. It's a calendar. It's a calendar that you have to hang on your wall. It's 66 pages. Actually 33 pages. Front and behind it is 66 pages. Okay, all the microorganisms are covered in comparative table. I guess you can see the tables. Under a fixed set of heading, you can see the fixed set of heading. Under a fixed set of heading, all the 150 microorganisms, system-wise, we have done the color coding. It's covered. And I'm going to teach in that format only. Okay, you can take your copy, pen from tomorrow onwards and make these tables. Own handwritten, or it's available the printed form. If you want the ready-made version, it's available, but I will prefer you make of your own. Once you write it of your own, you will never forget. I applied this format when I was in second prof MBBS, and till date I have taught many batches. I'm teaching since last 13 years. I have taught many batches with this format and with a grand success in that. It's already tested, okay, and it's already verified. Many students got distinction, gold and 100% strike rate with these master charts. Okay, so don't take it lightly. I will tell you how to make it. Even if you are not attending my further sessions which are on app, MedLive by Dr. Priyanka app, the remaining 5 sessions will be there. The remaining systems. Okay, but this session is very special in which you will understand the approach of the systemic microbiology. And here we will understand the microbiology not organism-wise, it's system-wise according to latest CBME curriculum. Okay, please appreciate the schedule. Every day session will be 6 to 10, approx 3 to 4 hours session will be there. So you do 4 hour or 3 hour or 3.5 hour into 7, approx 25 hour rapid revision plus minus 2-3 hours will be there. Okay, it will be plus only, not minus. So that is not too important announcement. Too important. Wait for the announcement. Okay. The first important announcement, there is quiz at the end of the session. After 5 minutes, maybe after 2-3 minutes, when I will end the session, after 5 minutes of that, we will make the quiz live. You please read the rules. The quiz is available on MedLive by Dr. Priyanka. If you have not installed the app, please install it. Okay, you will get the quiz link. And the link is also pinned in the comment section of this video, what you are watching right now. So go in the comment section. Okay, it is posted in comments also many times. And see the this message, you will get the link. You click the link and you will get the quiz. There are just 10 questions. Okay, just 10 questions. The questions are very simple from the session. If you are attending in the session, their questions are very simple. Okay, you will get 30 seconds for one question. The quiz will be live for just 20 minutes from the point of onset. From the point of, publish, we will publish just for 20 minutes. And after that, we will close it. The top 20 scorers will get free master chart. This master chart, we will deliver them free. Okay, the 66 page, this calendar, you will understand this magic. So don't you forget to give the quiz. You can try your luck also. If you are among the 20, we will share the leaderboard also. Okay, with you. You will get the result after 20 minutes only. Just suppose you are attempting the quiz, the very first minute you have attempted the quiz and you have finished it very fast. After 20 minutes, you click on the same link, you will get the leaderboard. So leaderboard will be declared after 20 minutes once the quiz will be over. Okay, and you will come to know that whether you are the lucky first 20 or not. Okay, now tomorrow I'm going to teach you bloodstream and serious infection, 25 microorganisms, 6 p.m. the same YouTube channel. Don't you dare to miss it, and inform all the colleagues whosoever interested in understanding microbiology, this topic in the most simplified way. Okay, throughout the globe. Kindly help me in sharing the link with everyone. Okay, now in tomorrow's session, not today, in tomorrow's session, we are giving free scholarship of our app. Free scholarship up to 100% scholarship will be given to the top 20 winners. Tomorrow also we will conduct a quiz from the CVS and bloodstream infection. And tomorrow the top 20 winners will be awarded up to 100% free scholarship of MedLive by Dr. Priyanka of this plan, Rapid Revision Final Microbiology. Okay, in this plan, you will get the 7 live sessions. The first 2 on YouTube, the remaining 5 on the app. The recordings will be available according to the subscription taken. 3 months, 6 months, 1 year subscriptions. Okay, digital notes will be provided, not hard copy. Annotated notes will be uploaded every day. Okay, quiz will be uploaded topic wise every day. 7 quiz you will get. A set of 100 questions. Okay, so 700 questions you have to attempt based on the session daily. Printable workbook. I recommend to take a printout of the workbook before you attend my session. Okay, otherwise you will not be able to pace with my speed. In tomorrow's session, if you are attending, kindly upload the workbook, download it and take a printout before you attend the session and you will get the question back. Okay, for any queries, please note down the number. Don't call it. Okay, please WhatsApp your query. Or you can text your queries on the social media. I'm available on the Instagram, YouTube, Telegram by MedLive by Dr. Priyanka. So you can post your query either WhatsApp on this number or you can post it on the social media platform. You can tag me. Thank you so much. It was very, awesome session. I enjoyed a lot teaching you people, the young brains, the energetic brain. I always enjoy. Okay, hope to see you tomorrow. I'm ending the session. Wait for just 5 minutes. And after that, you try clicking on the link. After 5 minutes, we will make the quiz live. Okay, so are we meeting tomorrow? 6 sharp. Are you ready to inaugurate the systemic microbiology, a new approach, a new perspective? We have not seen a microbiology with such a perspective. Yes or no? So how many of you were thinking that microbiology was boring at the beginning? It's monotonous, non-conceptual. That was my first question of the session. Am I able to change your perception? Yes or not? Microbiology is one of the most interesting subject out of 19. Okay, believe me. Chalo, bye-bye. Good night. I'm ending the session. Hoping to see you again tomorrow. Bye-bye.